together with the knowledge. I'd now like to pass it on to Amitesh, who will give the instructions for the participants.
Good morning to all, and good morning to the judges. Just a few instructions. We will be sharing the screen for the candidates' entries. So candidates, please do not share your screen. Candidates, kindly switch on your mic and your video while you're presenting, and you will be given a maximum of 10 minutes to present, which will be followed by question and answer session by the judges. Thank you. So we'll go on with our first participant.
Before we move on, we'd like to welcome our judges on the panel today, Dr. ARUN Murugan sir and Dr. Sarvana Kumar sir. Dr. ARUN Murugan sir is currently the professor of the Department of Community Medicine in the Government Medical College, OMANDURAR Government Estate. He's completed his MBBS from Kilpak Medical College and MD in Community Medicine from Madras Medical College. Out of the many noteworthy achievements that he has to his cap, he has designed the Nalamana Tamilagam, which is now followed by the government of Tamil Nadu, diabetology and hypertension community model, and also launched the pilot program on NPCDCS. Moving on to our second judge, Dr. Sarvana Kumar sir. He's currently the Associate Professor of Community Medicine in Kilpak Medical College and graduated from Madurai Medical College. He has many degrees to his credit, namely PG in DNB Pediatrics and MD Community Medicine from Madras Medical College and PhD in Tribal Health from Tamil Nadu Dr. MGR Medical University. He's also the awardee of the prestigious Kalluram Memorial Award for the Best Male Young Scientist IAPSM, and he has research experience in undernutrition among tribal under 5 children. We are indeed blessed to have you in our midst, sir. I'd now like to start by calling the first participant for the research poster. The first up is Karthik M, CRMI, Tagore Medical College, Chennai. Karthik, am I audible?
Yes, ma'am. Yeah.
Please start your presentation.
Actually, this is not my poster. Yes, this is my poster.
Yes, you may start, please.
Yeah. Good morning to one and all present here. My topic of today is geriatric depression and its risk factors in urban and rural field practice area of a tertiary care center institution in South India. Objective of my study to study the prevalence of depression in elderly population of urban and rural field practice area of a tertiary care institution in South India, and to find out the association with various socio-demographic factors with depression. Introduction. UN defines a country as aging or graying nation where the proportion of people over 60 years of age reaches 7% of total population. By 2001 itself, India has exceeded the proportion, which is 7.47%. It is expected to reach 12.6% by 2025. Indian elderly population is the current second largest in the world. many elderly persons are at higher risk of developing disorders of mental health, like neurological disorders, substance use problems, along with other health conditions like diabetes, hypertension, hearing loss, diminishing vision, and osteoarthritis, etc. Aging is a universal process that is associated with deteriorating health status. Today, depression is the most commonest cause of disability in elderly. Let us see the risk factors of depression. Main risk factors of depression are isolation from the family, loss of loved ones, chronic health problems, economic dependence, conflict with family members, family history of depression, dysfunctional families. Given significant impact of depression on elderly and need for early identification, this study is conducted to assess the prevalence of depression and relationship with its socio-demographic factors. Materials and methods. Study design is cross-sectional study. Study period is from September 2019 to November 2019. Study population, geriatric age group. Excuse me. Hello.
Yes, Karthik.
Sir, poster is not visible for me.
Just a second. ಇದು ಮಾತ್ರ Karthik, is it visible now?
Yes, sir. It's now visible. Yeah. Can you scroll it for methods and materials and method?
Yes.
Study design is cross-sectional study. Study period is September 29, November 2019. Pediatric age group that is more than 60 years of age of both sexes in urban and rural population and around the field practice area are included. Sampling methods and tool. Sample was collected by convenient random sampling with utmost privacy and confidentiality was maintained. GDS 15, Geriatric Depression Scale 15, which is a pre-tested, pre-validated questionnaire was used. Inclusion criteria, all permanent residents and of the field practice areas around the medical college around above 60 years of age who have consented for the study is included in the study. Exclusion criteria, individuals who are non-permanent resident are not willing for to participate in the study, and terminally ill patients with coexisting psychiatric illness like bipolar, dementia, and cognitive dysfunction are excluded from the study. The sample size calculation was calculated by formula 4PQ by L squared for rural population and urban population separately. For rural population, the p-value was taken from Reddy et al. Study. P-value is 50. P-value was 53%, 47%, and for urban population is taken from Arumugam et al. Study with a p-value was 41%. The n-value was calculated as 96 and 93 in rural and urban population respectively. Considering the non-responsive rate of 10%, it is rounded off to the value came as 106 and 103 in rural and urban population. The value is rounded off to 110 and 110 for rural and urban population separately. Now, moving on to research section, a total of 220 elderly individuals participated in the study, which comprises of 110 respondents from each rural and urban areas. In the results, the proportion of women outnumbered men. Women were 65.46% and men was 34.54%. A larger population of elders, 60% were in the age group of 60 to 69, and followed by 27.3% of the elders were the age group of 70 to 79. And then above 80 years of age, the elders were 12.75%. Majority of the population were married, 57.27%, and 40% were widow or widowers, and remaining 2.5% were divorced or separated. More than 65% of study population, both rural and urban population, belonging to nuclear family, and the remaining were belonging to 3-generation joint families. Regarding the employment status, 78.2% were unemployed or retired. 73.64% in elderly and rural population was unemployed. More than 80% were covered by social security schemes, then by CM pension schemes. In rural population, 34.54% of people in urban and 24.5% in rural are enjoying the social security benefits. Nearly 2/3 of study population are normal sleep deprivation. 25.5% in the rural, 30% of urban had chronic sleep deprivation. From these two tables, association between the socio-demographic factors and depression in urban and rural geriatric population are the results in the two tables. In urban geriatric population, statistically significant p-value which is less than 0.05 was obtained for social demographic factors like time spent with the children, appetite, and sleep deprivation, comorbid illness. In rural geriatric population, the statistically significant p-value was obtained for the social demographic factors like time spent with children, appetite, education status, and sex. Then coming to discussion, what comparison of depression among the urban and rural elderly population by GDS 15 scale. The table shows the prevalence of depression, rural elderly population, urban elderly population was found to be 36.4% and 30% respectively. Among 36.4% depressed population rural, 70% were moderately depressed and 30% were severely depressed. Among 30% depressed in urban population, 87.9% were moderately depressed and 12.1% were severely depressed. By discussing the prevalence of depression based on GDS 15 questionnaire in our study was found to be 30% in urban, 36.4% in rural. The urban population was taken from Krompet area, then rural population was taken from Kelambakam rural centers. Various studies conducted all over India revealed the prevalence of depression among the geriatric population varies between 6 and 53%. WHO studies also says the geriatric depression varies between 10 to 20%. Our study revealed that prevalence of depression was slightly higher in the rural community than in urban. Similar results were obtained a study by Alcom et al. Study, which was conducted urban and rural areas in Chennai. In that also the results was higher in rural community. Limitations, our study also has some limitation. There is a subject of recall bias during interview. Conclusion, in our study, the prevalence of depression was 30% and 36.4% in the rural and urban and rural areas respectively, which is higher. The prevalence of depression all over the world is 10 to 20% according to WHO studies. The higher rate of prevalence of depression among the geriatric population in our country is a greater concern. Steps like screening for depression among elderly, health education, health camps should be undertaken to diagnose a case of depression, and they should be treated with supportive psychotherapies, counseling sessions, medications, depending upon the severity of the depression. If untreated, it may even lead to severe depression and predispose to psychosis, bipolar, dementia, suicidal attempts, and psychiatric disorders. Thank you.
Mitesh. Able to hear me? Yeah.
Yes, sir, you're audible,
Mitesh?
sir.
Yeah. You can start with Dr. Sarvana.
So can you please repeat, sir?
You can start with Dr. Sarvana Kumar. He can start asking the questions first. Take it up, huh?
Yes, sir. Sir.
Dr. Sarvana Kumar, sir, are we audible?
Is he online?
Am I audible?
Yes, sir.
Yes.
Yes, sir.
Sir, you may carry on with your questions to the candidates, sir.
It's not registered. Sarvana Kumar.
Sir, can you please unmute and speak, sir? Yeah.
Okay, by the time we reach Dr. Sarvana Kumar, I'll start the thing. Amitesh, you can just call him and ask him to unmute. Maybe there's some issue with the signal over there.
Yes, sir, I'm following. Yes, sir, I'm following up, sir.
Yeah. Okay, fine. So, Karthik, what made you take up this topic?
Sir, there is the geriatric population is increasing and their health status are deteriorating, sir. So there is because we need to identify this problem and treat them by medications or according to the therapies or psychotherapies or supportive counseling should be made for their health, sir. For that only I have taken this topic.
So there are two components in your study. One is the prevalence, other one is the associated factors.
Yes, sir.
Okay.
Yes, sir.
So based on the prevalence, you come across around 37% in the rural area, which is very high because ultimately speaking, we are looking at nearly 2 out of 5 being depressed.
Yes, sir.
And among that, 12%, that is out of the 37%, 12%, that is 1 in 10 being severely depressed.
Severely, yes, sir.
Okay.
Yes, sir.
Yeah. So this says that the situation is very grim as per your study. But is it so in the field level? Can I take it like this? Every 10th member I meet will have severe, geriatric person I meet will have severe depression. Can I take it that way?
Sir, yes, sir, you can take it that way, sir.
Okay. For example, for me to take it that way, so what have you included in your study design?
Sir,
So that bias has been eliminated.
Sir, actually, we have taken more than 6 years of all the geriatric population, both including both sexes of more than 6 years of age we have taken, sir. But we are taken only convenient random sampling, not stratified random or like that, sir. We have taken whatever the elders we come across, we take it included in our study, sir.
So can I say that is the limitation of the study?
Yes, sir, we can say, sir, that
By
even that is also a limitation, but some kind of recalling bias may be there in our study, sir.
Naturally. So by chance, if you have done a high level of this systematic, this person could have come down 6 or 7%.
Sir, sorry, sir, I'm not audible, sir.
No, your convenience sampling method. Okay.
Yes, sir.
Can you hear me?
Yes, sir. Yes, sir.
Now you can hear me. Okay, you have done a convenience sampling method. By chance, if you had followed a better sampling method, like a systematic or a random sampling method,
yes,
would have the prevalence, I think, should have come down to 6 to 7%. Do you agree with me?
Yes, sir. I'll agree, sir. Yeah.
Okay. Then what stopped you from doing that?
Sir, the population, the 110, totally 220 is our sample size, sir. For age-wise, the equal sample may not be accurate by us, sir. So that because majority in our study was around 60 to 70 years of age, sir. 70 to 79 is slightly lower, and above 80 is more lower than that, sir. If we divide the total sample size into 3, means equal sample might not be convenient for us, sir. So that depending upon all
that is a stratification component where you stratify and give equal responsibility to each and every strata. But what I'm asking you is about the sampling design as such. Maybe if it had been a better sampling design, your numbers could have come down. So there is a lot of bias in your results. That's what I want to say. Do you agree to that, or you refute my statement?
Yes, sir, I agree. There might not be huge difference. There might be slight difference according to.
So how much should it, like from 12, the severe depression could have come down to?
Somewhat around 10, sir, maybe.
Okay. Next thing is gender-wise, how was your selection procedure?
Sir, gender-wise, I haven't actually. there is no 60 more than 2/3 of the study population are only female, sir. Only 1/3 of the study population is male, sir. Even that also was problem for clarifying, sir.
Yeah, it makes a very loud bell, okay? Because
Yes,
normally depression is associated more with the female population.
Yes.
Then you're taking a biased population and you're trying to project it to the general geriatric population. But if the study title is more of female geriatric population, then your maybe your outcomes would have been much more pertinent. Okay, so that you need to address. If by chance you're redoing or you're going to scale up the study, you need to address these points. Fine. So there are 2 points here. One thing is risk factors. The other one is other things associated with depression. One is which comes before the depression. One which comes after the depression.
Yes, sir.
So what is the most striking risk factor you have found out in this study?
Sir, striking risk factors around economic dependence, sir, because most of the population in my study are dependent on their parents. I mean, dependent on their children or depending on the CM scheme, like that pensioner scheme, sir. They are not having the income or something to lead their lives, sir. That is my.
Okay, fine. So if that is the issue right now. So what will be a solution?
Sir, my solution is taking care of them for their health in our hospital sake. We'll take the patient to the hospital and
hospital side you cannot take all the geriatric patients inside and keep them here. Then they'll get all the hospital acquired infections. So then what can be done? Think about community medicine.
Sir, community medicine, many health camps may be conducted in their rural level and addressing their problems. They can be given some incentives by our college side, something, sir, in hospital.
No, by chance, if you want to suggest something to the government of Tamil Nadu, what will you suggest to tackle this issue?
Sir, opening some old age homes like that and taking care of them by the government.
So you mean people in old age homes do not have depression?
Sir, they might be having, sir. They are around they are with their same age group of people, so they can be who are willing for that matter.
Okay. Now you've done a study, okay?
Yes.
And what new have you added to existing knowledge in this topic? Anything new you have added based on your study?
Sir, new. No, sir, not.
Okay, thank you, Karthik. Dr. Saran Kumar.
Thank you, sir. Thank you.
Dr. Saran Kumar, sir. Are we audible, sir?
Oh, sir, am I audible, sir? Sir, take it.
Saran Kumar, you can go ahead now.
Yes, sir. Yeah, Karthik. Am I audible, Karthik?
Yes, sir. Morning, sir.
Yeah, good morning. You have presented well, okay. I just have some queries in your thing. See, you are actually trying to do a study and you want to see whether in urban and rural, what is the prevalence of depression. Do you want to compare? You want to compare the depression, or you want to just say the depression is there in both the areas? You want to compare and contrast both?
Sir, both the things, sir. In our study, the rural population were higher, the depression, higher rate of prevalence of depression was seen, sir. And I am comparing both rural and urban in that point. I'm suggesting something. What can be done for their to reduce?
Okay, fine, good. Okay, fine, good. That's good. Yeah. See, when you yourself accept, no, in literature there is difference between the prevalence of this health issue in urban and rural.
Yes,
so in the methodology, when your objective is to compare the prevalence of depression and the factors between two different populations,
okay,
the way of calculating the sample size, the methodology, it is a comparative analytical study. Comparative, cross-sectional. In cross-sectional, we have analytical components.
Yes, sir.
Okay, so it is a comparative study. So for comparative study, the sample size determination is not as you have done. You have done I hope that Z PQ by D squared, correct? That one. So you have used this formula. This example, you want to see the prevalence in urban alone. Then you take the literature, you take the prevalence, what the literature says, and you want to calculate a sample size so that your study will reflect somewhere near to that or higher or lower than that based on the literature. So
Yes,
for
sir.
this particular study, you should have included a different type of sample set determination where you will have two different arms. So I think you have taken 220 and you have divided as 110, 110. Correct?
Sir, yes, sir.
You have taken
110 rural
220 and you have
population.
divided as 110, 110. Am I right, Karthik?
Yes, sir. Yes, sir. Yes, sir. Sir, I have taken
That's what
110
you have
in
taken
rural population,
220.
110 in urban population, sir.
Yeah,
For
that's
rural
what.
population,
So 220 was the sample size.
yes, sir.
Yeah,
Yes,
let me finish. 220 was the sample size what you got from the formula, correct? Huh?
yes, sir.
Yeah, that one you divided into two. You assume that you will divide equally into urban and rural, but that is not the way of doing. Okay, you have to calculate based on two prevalences. There's a different formula. We have two prevalences. There is a difference. You
Sir, I
want
have
to show
calculated.
whether in your study the different. Yeah.
Sir, excuse me, sir. I have calculated
Yes, come again.
two prevalence only, sir. For
Yeah,
rural
please.
population, I have taken it from one study called Reddy et al. Study. The p-value was 47%, sir. For urban population, the
Am I
p-value
audible,
was sir. Sir.
Karthik, the voice break out.
Sir, one minute. Sir, it's
Sorry,
now audible,
sorry.
sir. Sir, I have taken for rural population separately
Yeah,
110
continue.
sample size, sir, and urban population separately for 110 sample size, sir. For that, the p-value was taken from two different studies, sir. One study, the p-value was taken from Reddy et al. Study, p-value was 47%, and urban population, I have taken it from Murgan et al. Study. The p-value was 41%,
You
sir.
are correct. What I am trying to say is you want there is a difference, but you want to know whether it is same or it is more or it is less. So for that type of methodology, the sample size we used to have two prevalence, P1, P2. It's a different way. So this will not actually reflect what our study wants to, what it wants to explore. That is one thing.
Okay.
Second thing is you have told about the secondary object. Second objective was you want to know the factors determining the factors determining. So you have brought out mild, moderate, severe depression, and you have not highlighted what factors were important, playing an important role in rural, and what were the factors in urban. You have put in the results, but you have not discussed, you have not highlighted the second object, your secondary objective, that you have not highlighted well.
In the poster,
That is one thing.
but I have explained it, sir. What are the
you have to
factors?
the discussion, you have to say, you infer from the results,
Yes.
what you want to see. And in conclusion, see your conclusion, you have just told you want to screen people and you have to give them psychotherapy. See, you should have also explored what our health system is doing for this problem.
Okay, sir.
You should have also explored whether these people have got any access to healthcare for this particular depression. Have they approached primary healthcare, or have they approached secondary healthcare, or they have approached tertiary healthcare? What is the treatment they have done? Otherwise, where they really our system is addressing this problem or not. So how to also inquire about the health seeking behavior for this problem. Whether they have sought for any help, did medical help was neglected. See, sometimes they will not know that they have a problem. Sometimes they might know that they have a problem, but they wouldn't have gone for medical attention. Third thing is they would have gone for medical attention, but they wouldn't have been properly handled. So we want to know what health system is also doing. So that because you are continuing, you should give psychotherapy and you should give them that sessions. So before concluding, you should study. These things are already there in the community or not. Suppose I tell you, in urban we have counseling sessions, in urban we have something like psychotherapy going on. In rural it is not there, in the health system. You can conclude that in urban, because of these things, the prevalence is low. If you also do in the rural similar health sessions, some counseling sessions or something in the primary care level, you can definitely reduce the problem, because ultimately our aim is to benefit the children. So second thing you have to know that all these factors lead to dementia, all these things. So you also explore in the study whether they have dementia, whether they have suicidal attempts, all those things. Then only you can conclude. So conclusions should be from your study and not general conclusions.
Okay, sir.
So you have to change your methodology and sample size has to be revised and you have to highlight the factors. What are the factors which have you identified? What is the main difference? Is the difference, as already sir has mentioned, no, you have highlighted high prevalence of problem. So what is the reason for high prevalence? Is it really high? Is the sample size able to bring out the difference? All these things you have to conclude. Okay. Good.
Okay, sir. Yes, sir. Thank you so much. Thank you, sir. I'll do it, sir.
Thank you.
Thank you, Karthik. Following that enriching discussion, I'd like to call upon Govind Gopakumar, third year MBBS, ESIC Medical College and PGIMSR, Bangalore. Kindly start your presentation, Govind, after switching on your video and audio.
Hi, good morning. Is my audio and video clear? Hello?
Yeah, Govind, you can go ahead.
Okay. So good morning to 100% here, especially the judges, to my colleagues and all. So myself, Govind Gopakumar, I'm a third year medical student at ESIC Medical College, Bangalore. Today, I'm presenting the poster on testing reliability and validity of an academic stress and inventory for use among the Indian medical students. So as you all know, medical field is an area of immense stress. The students which have gone through the first 4 years or 5 years, the change from a +2 point of view to a professional course is really too much. And above that, the COVID recently struck. The impact this COVID has caused on the mental health of many students is really depleting. So the aim of the study of why I conducted this was to understand what happened due to the COVID impact on these already existing medical education. Stress negatively impacts medical health among the medical students. 1/3 of the medical students worldwide will be having their depression. And the most important point which I have to emphasize here is at least 1 or 2 suicides are reported each year. Now, why this study? I really wanted to conduct a study based on the stress levels and how much is the stress Indian medical students is having. So the first problem
Govind, your audio is stuck. Govind, am I audible?
The last one.
Due to unprecedented issues with connections, Govind Gopakumar will be presenting later. Let us now move on to the next presentation by Apurva Reddy Edla, who is a fourth-year MBBS student from the Medicity Institute of Medical Sciences. Apurva Reddy, you may start presenting after switching on your video and audio.
Hello. Am I audible?
Yes, you're audible, Apurva. Apurva, you may start presenting. Both your audio and video are clear.
Good morning, everyone. My name is Apurva, and I'm in my fourth year MBBS, and I'm from Medicity Institute of Medical Sciences. Firstly, I would like to thank you for this opportunity. And I'm here to present a research paper I've done for the STS project by ICMR. And it's on prevalence of back pain, joint pains, and fatigability in young adults of Hyderabad, Telangana state. So as we can see in this current world, most of the young adults carry a lot of weight around their shoulders. They carry heavy backpacks with heavy books, laptops, tiffin boxes, water bottles, etc., etc. And knowingly or unknowingly, we carry this weight around our shoulders for about 10 to 12 hours each day. Moreover, we travel for a very long time in cars, buses, and considering the traffic, all this puts a lot of strain on our backs, neck, and knees and other joints. So day in and out, we often hear our friends and colleagues complaining of back pains or neck pains and other joint pains. And we often hear this complaints in elder population, but when it comes to the younger population, we often ignore it. If it's in milder form or if it can be managed with medications, we usually oversee this issue. But back pain is something that, if not checked and controlled, will only progress, leading to a major drop in quality of life as we grow older. And hence, I think we must study about this and know the current status of the population to take necessary measures. And surprisingly, there is not enough literature regarding this emerging problem, and therefore we designed the study with the following objectives. First, to determine the prevalence of back pain, joint pains in young adults aged 18 to 35 years. Second, to study fatigability, muscle strength, and endurance in the study population. And third, to determine the risk factors associated with back pain, joint pains, and fatigability in young adults. This study was conducted in the urban areas of Hyderabad in a cross-sectional study design. The study duration was 2 months, and my sample size was 384 young men and women between the age group 18 to 35 years. And they are the ones residing in urban areas of Hyderabad and studying or working in institution. The sample was randomized by simple random sampling, and the inclusion criteria was to include the people aged 18 to 35 years residing in urban areas of Hyderabad, apparently healthy, not suffering from any chronic diseases, locomotor disabilities, and neurological problems. And they have provided a written informed consent. And the exclusion criteria was to exclude the people suffering from any bone diseases, terminal illnesses like cancer, HIV, chronic physical disabilities, neurological disorders, etc. And the study was cleared by the Ethics Committee of Medicity Institute of Medical Sciences. And we investigators were trained for about a week in the Department of Community Medicine regarding the study protocol, administration of questionnaire, and the measurements. We measured on volunteered subjects who were not included in the study. And I myself collected the data and made sure that confidentiality was maintained. And for the measurement, we used 4 scales, that is neck disability index, modified Oswestry low back pain disability questionnaire, Roland Morris disability questionnaire, and field StatBack screening tool. In modified Oswestry low back pain disability questionnaire and neck disability questionnaire, it had a set of questions with scoring system, and based on the score, the pain was classified into no disability, mild, moderate, severe, and completely disabled. And Roland Morris disability questionnaire had a set of 24 statements, and the score was ranging between 0 to 24, 0 being no disability and 24 being maximum disability. And coming to Keele Startback screening tool, this had mobility and pain related questions, and there were only two possible answers. One is agree and disagree. This was basically a subjective type of questionnaire. And according to this, we classified the participants into low, medium, and high risk population. And we also did some anthropometric measurements, height, weight, hip circumference, waist circumference, and then we calculated the hip waist ratio and BMI. And we also did some tests for the lower limb endurance. One was sit to stand test, in which we asked the participant to sit and stand for 5 times as quickly as possible, and then we calculated the time. And the other thing was partial squat tests, where we calculated the time taken by the participant to, we calculated the number of squats done by the participant in 60 seconds of time. And there was another test called knee to wall test, where we asked the participant to touch the knee to the wall while their ankle is stationary. And we measured the distance from the wall to the tip of the toe. And after all this, we also measured the blood pressure in the participants using a digital monitor. And coming to the data entry, the data was entered in a Microsoft Excel sheet and was analyzed using SPSS. And continuous variables were expressed as means and standard deviation. Non-normally distributed variables were described using median and interquartile range. Chi-square test was employed to compare two groups of categorical variables, and t-test was used to report continuous variables. Logistic regression was done. Odds ratio, risk ratios, and 95% confidence intervals for associated risk factors were reported. And p-value less than 0.05 was considered as statistically significant. And coming to the results of our study, in our study, we found that about 82% of the girls and about 64% of the boys complained of back pain at some point of their life. And out of which 23% of the boys and 26.7% of the girls often experience back pain regularly. And about 47% of the boys and 65% of the girls experienced neck pain at some point of their life. And with the modified Oswestry low back pain scale, we found out that about 14.5% of the boys and 11.3% of the girls had mild disability. And with the Roland Morris low back pain and disability scale, we found out that 44.4% of the boys and 48.5% of the girls had grade 1 functional limitation. And with the neck disability index scale, we found out that 37.1% of the boys and 56.2% of the girls had mild neck disability, and about 11% of the boys and 16% of the girls had moderate neck disability. And with the Keele Startback screening tool, we found out that 9.7% of the boys and 7.5% of the girls were at medium risk of back pain. And coming to the grip strength, we used a hand dynamometer to measure the grip strength. And we found that the dominant hand among the boys, the grip strength of the dominant hand of the boys was more than girls. And the muscle endurance was better in boys when compared to the girls. And the risk factors, the significant risk factors were gender. Females had increased prevalence and increased BMI, history of back pain, physical inactivity, and long traveling. So I would like to conclude now, and according to my study, we found that the prevalence of back pain and neck pain is high in our study population, and it was higher compared to it was higher in girls when compared to boys, but the other joint pains were comparatively higher in boys. And the neck disability was in milder form, but it was higher among girls. The muscle endurance and muscle strength was better among boys when compared to girls. And low back pain, disability, and functional limitation are higher in our population. And among those risk factors, we found out that female gender, high BMI, history of back pain, physical inactivity, and long traveling to be significantly associated. Thank you.
Can Dr. Sarvana Kumar, sir? Dr.
Am I
Sarvana
audible,
Kumar?
sir? Yeah, am I
Yes, sir.
audible?
Audible, sir. Yes, sir.
Yeah,
We can start.
Dr. Apurva, you have done, presented well, good. And I have just listened to you. You have taken one important health issue among the young adults, that is, who are economic as well as productive population. Am I right?
Yes, sir.
Yeah. So in this study, you have highlighted a problem, and in your introduction, you were telling that this affects the quality of life, long run. Correct?
Yes, sir.
So in your study, you have to highlight how this problem has had an impact on their quality of life, as well as if it is not treated or if it is not attended to, what will be the health consequence. So that things, if you have also highlighted, it will be like something like a particular problem, if it is neglected, maybe it will go in for so percentage of decrease in quality of life or performance. For example, some academic performance or some work performance, something like that. And in your study, you also have to include, you have included any expert in physiotherapy, experts in orthopedics, like that, physical medicine?
I didn't get you, sir. Sorry.
So have you included any experts in physical medicine, orthopedic medicine, orthopedic field and physiotherapy, that particular area? Any experts have you included in the study as a expert to give opinion?
No, sir. We haven't included them.
You are a student, medical student. You have been trained to conduct a research, but this topic also includes some ailments and some problems, which is of also some other specialty, no? For example, so you would also got them into the, expert opinion, whether what we have obtained, is it really the burden or how far it is reliable for that particular. And what I want to highlight is, and how it affects our health and economic and productive life. If you highlight, that will be the more, the thing what we want to focus on. And if you want to recommend some example, future, some programs for particular problem, no, for any health problem, the program will be based on what is the burden, what is the impact on the health. By attending to this particular issue, how far we can give a better quality of life and how can we can reduce the morbidity like that. So that is, and you have included males and females, correct? 18 years,
Yes,
33 years. In your table, you have put boys and girls. So that shouldn't be, I think boys and girls, no, you have put in the table somewhere in the, it's actually not boys and girls, it is males and females, okay? That type of things you just focus. And conclusion also, what do you want to conclude? See, you are telling that some problem exists in the community. But what is that going to do to the community? How far it is going to affect their health, or how far it is going to be a either a chronic problem? And if it is neglected, what will happen? Is there any data, something like that you have to conclude? That is what you are going to conclude from your study. So instead of just telling a problem exists, you also say what it does and how the system should respond. And also you have to find out how our health system is going to handle this problem in future. Maybe you are right. This is a thing which has to be focused, musculoskeletal issues, because now we are moving more towards NCD. No, one of the NCD is this particular problem, locomotor disability, quality of life affected. So that will be right if you add up.
Yes, sir. We tried to search for more literature regarding this, but we couldn't find much about the previous studies.
No problem. You have done a good attempt. I just want you to say how far it's going to affect the health and what is it going to do and what you want to recommend finally. Thank you.
Yes, sir. Okay.
Okay, Apurva. It's nice to see. It's nice to see you identify a problem which is pertinent to today's world and do a study on that. Again, did you choose this topic or somebody else chose it for you?
No, sir, I chose it by myself.
Why?
Because I often hear my cousins or siblings and friends complaining of back pain more than actually my parents or anyone. And I kept wondering that if this is the situation today, and when we grow older, what is it going to be for us? Like the severity is going to increase, other problems are going to come into play, and it's going to be painful at that time. So I wanted to know more about this and take proper measures.
In your study title, you had mentioned the term young adults. So what do you mean by young adults?
Young adults, I tried to define it, and after a lot of research, I came to the conclusion that it's 18 to 35 years of age group.
But again, you had mentioned in the justification for your study or the problem set, they are using their backpacks for more than 10 to 12 hours. Is it so?
Yes, sir. In the morning while traveling, they usually carry their backpacks. And again, if they're in institutions, they again carry their backpack and go around the campus. And again, while going back home, which is an again 2 hours and again.
So I presume you also come under the definition of young adult, right?
Sir.
Do you carry a backpack for 10 to 12 hours? When I mention this, underline the word carry.
Yeah, I haven't realized before, and I didn't believe that it would be 10 to 12 hours, but after calculating the amount, it actually came around 10 to 12 hours.
Okay. In your entire study, I feel it's nice to see you putting up the scores and all those stuff. Very good. But I see always the women seem to be much more weaker and they tend to have much more pain. Why?
I think it's because of the muscle strength we have in females, because of estrogens and everything, they affect the muscles differently, and our physical activity is comparatively lower than males.
So naturally we can expect females to have more pain, right?
Yes.
We don't need to do research to find it out. Okay?
Yes, sir.
So now is your research differing?
Sorry?
How was your research differing from that?
We're specifically concentrating on the back pain and joint pains area where it's not related to menstrual cycle or other issues. It's just how your attitude towards lifestyle is affecting it. If we females also...
You come with the same conclusion. All the females are more affected. Sometime back, we agreed saying that you don't need a study to find this out.
But we need a statement like this. There was a research supporting my statement. I can just.
Okay, fine. So, Amitesh, if you can zoom on to the last table just before the conclusion. Anybody there apart from Amitesh? Okay. If you can, yeah. Sapura, just have a look at this table. The first component, that is female sex. Okay. And you matched it against two groups, that is the boys and girls. Can you explain that?
Yeah, actually, sir, there was a typo over here. It was just supposed to be gender and it came out as female sex.
So what should have been it? Gender.
Gender, just gender.
Gender. So gender again, because the groups are gender based. Then how will you match gender within the groups and get because automatically you'll get a p-value. Boys and girls are gender based groups only, you know?
Yes, sir.
Even though Dr. Kumar objected to that, males and females could have been a better nomenclature. Okay.
Yes.
So from this, I'll take it as a typo. Okay. I think you need to be careful on all these things. Next,
Yes.
by this table, I find all women to be obese, fat. They have higher history of back pain. The physical activity is very low among women, okay? And they tend to travel very long. How will you justify that?
Well, of course, everything is again interrelated. Low physical activity will again lead to higher BMI, and higher BMI again the history of back pain.
I don't know whether in Telangana or in Hyderabad, women tend to travel in long distances more than men.
Well, we're all young adults. It depends on the places we live in and not exactly gender based. And in our
Now, what will you?
sorry.
Okay. Now, what will you recommend from this study to government of Telangana?
Well, I would like to recommend that we need a lot of lifestyle changes. We need to promote physical activity. We need to ask the institutions to give at least half an hour to 1 hour every day for the students to play games or some kind of exercise, and encourage students to do exercises like plank. Plank works for
We are talking about young adults, no, not students. We're talking
adults.
about college students, is it?
College students, and again, they're postgraduates and working individuals.
Okay, fine. So, what is the new component, new dimension in your research, which have added to existing knowledge?
Existing what?
So, anything new you have added to existing knowledge on the subject?
Well, yeah, there were no previous literature saying that there was increasing back pain in young adults. Even though we subconsciously knew about it, we didn't emphasize it on enough. We ignored it a lot. So I thought I'll.
Okay, thank you, Apurva. Nice job.
Thank you, sir.
Following that enriching session, we'd like to call upon the next participant, Vishwajit VG, who's a second-year MBBS student from Coimbatore Medical College. Vishwajit, you may start after unmuting and switching on your video, please.
Good morning. Am I audible? Hello?
Yes, you're audible.
Yeah, I can start. Okay.
Wait, could you give us a minute, please?
Yeah, sure.
நான் 3 தான் லோட் பண்ணி வச்சிருந்தேன் ஏன்னா 3 ஓவர்லோட் ஆயிடுது.
Is your poster visible on the screen, Vishwajit?
Yes, it is.
Yes, you may start.
Okay. Good morning, respected judges. Today I'll be presenting my study, a community-based cross-sectional study to assess the prevalence of diarrhea among under 5 children in Coimbatore. Diarrhea is one of the most important causes of death in the world. In India, diarrhea is responsible for 13% of all deaths per year in children under 5 years of age. It is an important cause of mortality, morbidity, and it's also the leading cause of malnutrition. Hence, the objectives of our study were to assess the prevalence of diarrhea in children under 5 years of age and to study the various determinants of diarrhea in under 5 children. So this is actually an ongoing cross-sectional study being conducted in the field practice area of the Urban Health Center of the Department of Community Medicine, Coimbatore Medical College. And we have planned the study to be conducted for a period of 2 months, from 2nd August to the 1st of October. Regarding the calculation of the sample size, we have taken prevalence to be 3.6% which is in accordance to the National Family and Health Survey 5, and with 95% confidence interval, 5% absolute error, and considering a 10% loss of response, the sample size was calculated to be 65. The data is being collected using a pre-designed and pre-tested questionnaire, and the data was entered in Microsoft Excel and is analyzed using EpiInfo7. Before conducting the study, we did obtain oral consent, and at the end of the question answer session, we imparted health education to the study participants regarding diarrhea and its management. So as this is an ongoing study, I'll be presenting the results of the 35 samples that we have collected till now. Yes. Out of our total study population, the gender distribution shows that 45.7% of our study participants were male and 54.29% of them were female. And when we did look into the prevalence of diarrhea, 22.86% of them had suffered from diarrhea in the past 2 weeks, and 31.43% of the children were hospitalized for diarrhea in the past 1 month. Now, moving on to the parents' education. Most of the parents were graduates, followed by middle school, high school, and primary school. Only 2.94% of the fathers were illiterates. The occupation profile of the parents showed that 5.88% of fathers and 60% of mothers were unemployed. 38.24% of fathers and 8.57% of mothers were laborers. 23.53% of fathers and 2.86% of mothers were in the business. 11.76% of fathers and 11.43% of mothers were independent professionals like drivers, cashiers, and clerks. 20.59% of fathers and 17.14% of mothers were in the government service. We also asked the parents regarding their healthcare preferences when their child suffers from a diarrheal episode. 48.57% of them preferred going to a private hospital or clinic. 25.71% preferred going to a government PHC. 17.14% preferred to get treated at a government medical college and hospital, which is a tertiary care center, and 8.57% preferred being treated at home using home remedies. On questioning about the feeding history, we found that only 68.57% of children were exclusively breastfed. The most common reason for not following exclusive breastfeeding was the production of insufficient breast milk. Out of the total, 28.57% of children were also given pre-lacteal feeds, which included honey, glucose water, and formula feeds. Cereals and pulses are the most preferred weaning food, followed by smashed fruits and smashed vegetables. The mothers were further questioned to analyze their knowledge on diarrheal disease. Most mothers exhibited good knowledge about the signs and symptoms of diarrhea, but none of the mothers were aware about the role of zinc. Regarding the knowledge of child management during a diarrheal episode, 91.4% of them insisted on visiting a healthcare facility, 74.29% agreed on the use of ORS at home, 34.29% agreed to give homemade fluids and such as Seeragam water, 85.71% wanted to breastfeed the child, and 14.29% wanted to stop feeding the child. Now, moving on to the discussion conclusion. In our study, we found that the prevalence of diarrhea was 22.86% compared to 3.6% in the National Family and Health Survey. The child's age, maternal literacy, inadequate breastfeeding, poor sanitation, and hygiene practices of the mother can all be associated with the incidence of diarrheal disease in young children. The data in a study shows that while caregivers are aware about the signs and symptoms of diarrhea and some about the usage of ORS, there's a large gap between knowledge and practice. Most mothers are not aware about the importance of zinc supplementation, despite the National Health Mission. Previous studies have shown that the education status of the mother has a strong positive correlation with diarrheal disease. Breastfeeding is also an important preventive measure, yet only 68.57% of mothers in our study have followed it. Pre-lacteal feeding is still practiced despite its associated risk, mainly due to the lack of awareness. In conclusion, diarrheal diseases are still a burden in Indian society. By studying the local scenario, we can understand the effectiveness of national and international programs, health promotion regarding preventive practices like breastfeeding, and research in the child of cost-effective interventions is crucial to reduce the burden of diarrhea among children in India. Thank you.
Dr. Sarvana Kumar sir, would you like to start off by giving your inputs, please, sir?
Yes, Vishwajit, good. You have presented very well. You have a very good communication skill.
Thank you, sir.
Your flow was good, and you are speaking with confidence also. Good. You have got that art of speaking. So this study is actually, what you are aimed at is good. But what I want to say is, this particular problem, diarrhea, generally it is a short duration health issue. So we generally say incidence of diarrhea. Only if a disease like diabetes, hypertension, or some chronic illness, cancers, or something that stays for longer time, so we call them prevalence. In general, we only talk about incidence of diarrhea among the toddlers or under 5. So that they have to just focus. And next thing is, this has been already being studied. What is that you want to add new from your study? What do you want to highlight?
Yes, sir. Actually, this is quite a research topic, and but as I mentioned in the conclusion, that we wanted to do this study so that we can understand how effective the programs are which are already being implemented, so that we can really understand it in the very local scenario, sir. So that's the added knowledge which I wanted to give. Okay, good. So you highlighted one thing about zinc, and I just want you to highlight few things in your study. One is, what is the health-seeking behavior of these mothers for diarrheal illness of their children? What is the health-seeking behavior? Whether they are giving any home-based remedies, or where they're going into primary health care, or they are going for a private sector, or they are trying to have any other practice of whatever it is. That has to be highlighted. And you said zinc, no? So how will they get the zinc? Who will give the zinc? All those things you have to highlight. And you should say whether harmful practices, what is the prevalence? Like bottle feeding, and as you said, it's non-exclusive breastfeeding. You said no sugar and then glucose was given, that and this. Okay. So what is the reason for this? Why still the prelactal feed is being, even we are celebrating every year, no? World Breastfeeding Promotion Week, all this. So what is that you want to do to change it? I wanted to say what still holds them in that. See, it is there in the literature that prelactal feeds are given, you are not giving all. So what is that still? What should we do? Health system, what should we do? If you highlight, it will be more thing. And very important thing is hand washing. So hand washing and sanitation, the type of approach in the mothers, if you explore and find out that this is one important issue that is not being practiced. So if that is highlighted, maybe we can reduce the incidence of diarrhea. Because we had our students or PGs doing studies in the community, like intervention study. For one group, they were giving a health education, hand washing, and reinforcement. Other group was giving the same thing, the care they were giving. So in hand washing group, and the mothers, if they are made aware, no, the diarrhea incidence came down when we follow the child for another 6 months. So like that, something you find out which can be done, so that is a common problem. Exactly, it's a very important cause of under-5 death. But we want to know what is the new thing we want to add to the already thing, and health-seeking behavior is very important, what they are doing. And you highlighted around 68% of exclusive breastfeeding. No? Your study. Is it really like that? Yes. Do you think that it is the breastfeeding rates, despite the awareness, it is still quite low. No, you are right. Yeah, what I'm asking is, in your study, you highlighted around 70% of exclusive breastfeeding in the mothers. Generally, it is very high. It is high figures. If you see in the literature about Coimbatore also, you're from Coimbatore, no? Yeah. What is the district level? What is the rural level, urban practices? We just go on literature. Generally in India, it is overall, it is this only. Even in spite of all good programs, so many things, we are not able to achieve it. So good thing you have highlighted. I want you to explore and find out what makes them still not able to overcome this issue. So good, Atom. Thanks.
Thank you, Dr. Sarana Kumar sir. Dr. Arun Murugan sir, could you please, can you hear us, sir?
I can hear you. Vishwajit?
Yes, sir. Fine.
Fine. Okay, again, I keep asking the same question. What is so interesting in this topic?
Sir, actually, this is quite, we read about this topic over and over again in community medicine and so many areas. And so I thought, why not directly go to the community and actually just check it out myself on how effective all these programs are. I read about so many programs in the textbook. So I thought, okay, why not we go actually to the community and see how it is.
Okay, under 5, and you look for the prevalence of diarrhea, right?
Yes, sir.
Yeah. So what is the prevalence?
The prevalence of diarrhea is, sir, 22.86% that had diarrhea in past 2 weeks. Sir. Yes, sir.
Okay. So 1 in 5 has diarrhea. It's quite high.
Yes, sir.
Okay. The next thing is you wanted to look at the determinants.
Yes, sir.
Dr. Sarana Kumar had asked a question, but rather than the determinants, you were more worried about the lacteal, pre-lacteal, and the feeding patterns in the children, rather than a lot of other determinants. If you open the textbook, there are umpteen number of determinants.
Exactly.
Okay, why didn't you go and screen them also?
Actually, sir, because we haven't attained the sample size, this is an ongoing study, so we haven't attained the necessary sample size. So even if we screen for determinants,
whatever it is, let it be 30, 40, 50, 60.
Yes,
the last question about open air defecation.
Yes, sir. So we did ask about question like hand washing, as sir had already mentioned. We did ask about hand washing, but the problem was when we asked about hand washing, like we asked the mother, did you wash your hand before feeding your child? Did you wash your hand before using the toilet? So every time the answer would be yes. Like obviously that will be the right thing to do. So that was one big barrier we faced while asking those kind of questions. Sir.
What should you do the next step? If they say yes, I can still, if you're not satisfied with the answer, what should you do?
We should probably
simple logic, no? Ask them to hand wash and show.
Okay, sir. Okay.
Simple logic. Okay, then you know whether they know about hand washing or not.
Definitely.
Okay. Similarly, if there is open air defecation in the community, the sanitation levels are going to be very low.
Definitely, sir.
Because still in India, nearly 63% of our children under 5 defecate in the open.
Yes, and we did go to their
Okay,
houses
so
individually and
maybe
check so we did go to their houses individually and check their toilets, sir, and we categorized the houses also. I just thought it just present the most complete data as of now, and later when I do the.
Actually, the determinants is more targeted towards the habits than the structure.
Okay,
so having a toilet doesn't always guarantee that people will defecate inside the toilet.
Definitely, sir.
So I think if you had gone and looked at all the other determinants, this would have been a much more comprehensive study. So it is just a part of the determinant. What you have addressed here is just part of the determinants. So more of the clinical side of the disease, but you have not gone into the community side of the determinants.
Yes.
I think that would have shown it would have put more light into your study. Fine. So by doing this, what has the research community gained from you?
The research. So as I highlighted, sir, first thing, it can highlight so many things. Like about the zinc usage in our communities. That is one thing, sir. Then we can also see that the preference of healthcare, most people still prefer a private hospital or clinic, despite all the advances in the government health sector. That's also one more important thing, sir.
So what will you suggest to the government of Tamil Nadu to get rid of this issue?
Well, so despite all the health interventions, there's still a lot of work to do, sir. So regarding the preference of healthcare to gain the public trust in government hospitals. So, you know, sir, when you walk into a government hospital, it's not a very pleasant place, right? So the first thing was obviously to improve the amenities in the government hospital. So that will really improve the public response. And yes, sir, that itself can solve many things, I feel, because when they go to a government PHC or hospital, so many things are given for free by the government itself. So most people can avail all their health services, sir.
What I can understand from your statement is you want the people to become diseased and then give them a good ambience, right?
Not really, sir.
Then what do you want to do?
So regarding prevention, sir. Probably midwives can go and impart health education in the community itself, sir.
Your voice is breaking.
Can you hear me, sir? So I said midwives can go in the society and impart health education, sir. Hello.
Sorry, Vishwajit, I didn't hear anything from you. My connection is unstable.
So I said midwives can go into the society and impart health education, sir.
Okay.
Yes,
so this is what you'll ask Tamil Nadu to do. Fine. So in your study, basically, everything is good, neatly structured and all the stuff. Maybe you could have added a little bit of statistical analysis, like what the other participants have done, which should have been an icing on the cake. But you have taken a very simple topic, so you should have been much focused on your topic, saying that exactly I want to find the prevalence, what is the issue, and how do I handle the issue from a programmatic angle. So statistically, I need to find an issue, substantiate that issue, and from a programmatic angle, how should I try to take care of the big issue. So if you have done that, or if you're planning to do the study again or upscale the study, try to be much more focused. Okay. Take one component and try to drive into that component. Okay. Thank you, Vishwajit.
Thank you, sir.
What was that? Bangalore Gate? Come on. Bangalore Gate.
Following that interesting and enriching discussion, it's time to move on to the next participant, Akash G, who's a CRMA from the Dhanalakshmi Srinivasan Medical College and Hospital. Akash, you may start presenting after switching on your audio and switching on your video as well. Akash?
Hello, can I share the screen?
No,
We'll be sharing the screen, Akash.
Okay.
Akash, the screen has been shared. Please let us know if it is audible and is it visible or audible?
Yeah, it's visible.
It is visible, right?
Yeah.
Yeah. You may start presenting.
So, yeah. A very good afternoon to one and all present here. I especially thank our co-CRRI and our PGs and our AP, Dr. Vijayalakshmi ma'am, for helping me to do this research. And let me begin here. My topic is on the impact of dimensions of health on aging among the geriatric population of rural area of Perambalur, which is near our college. So we know that India is one of the most rapidly aging countries in Asia. Now, due to increase in medical development and comparatively decrease in birth rate, the geriatric population will be more than doubled by 2030. So we should focus on the geriatric population. As per WHO, health is not simply an absence of disease or infirmity, but it's the presence of complete physical, mental, and social well-being. By this definition, we can clearly see that it is not merely an absence of disease. The person feels healthy. It is we should look from the multiple dimensions like physical, mental, and other social and ecological factors. So coming to our hypothesis of healthy aging, it is a ill-defined one, but we look from the multiple dimensions to assess whether a geriatric population is undergoing a healthy aging or not. So our objective of our study is to assess those various dimensions among the geriatric population in the rural area. It is a cross-sectional study done during January to Feb of 1 month duration in Feb 2020. Then it is the study place was in and around our rural health training center of our college, and our sample size was 119. And our study, we included the people belonging to age group of more than 60 years. And the part 1 of our study include pre-designed questions for assessing the socio-demographic details, morbidity status, and self-rated health for healthy aging. Before doing this, we done a pilot study a nearby village to analyze whether there are any difficulties in those questionnaires or not, and it was came to be good, so we continued the study. Then part 2 of our study include the various scales for assessing the physical dimensions, mental and economic dimensions. Then we used descriptive scales and analytical scales like chi-square test and odds ratio to find the strength of association between the dimensions and whether it has impact on our study or not. So the odds ratio, we used a binary logistics regression method. Then ethical issues, privacy and confidentiality were maintained, and only the willing participants were included in our study. Those who were morbidly ill were referred to higher centers for further management. Then the results of our study were most of around 68% of the population were distributed among the age group of 60 to 70 years, and the rest of 28% in 70 to 80 years, and more than 8 years only 14%. And the gender group, there are no any significant difference. Both were equally participated. Then can you go down the slide, please? Yeah, then the morbidity, coming to the morbidity profile, around 70% of the individuals were morbidly ill, and only 41 were comparatively healthy. Now, among the illness, myalgia and arthritis seems to be the most dominating one, followed by hypertension, visual problem, and health problem. While we are asking for the health status of how they perceive, nearly 70% were felt they were healthy, and the rest 30% were unhealthy. Then coming to the physical dimensions, those who are dependent and needs assistance, and those who are morbidly ill had a higher odds ratio of being maximum for the morbidity status of 28 times their chance of being unhealthy. Then coming to the mental dimensions, those who are depressed have 8 times are more prone for unhealthy aging, and those who are less socially engaged are 22 times more prone for unhealthy aging, and those who are illiterate and poor or below the poverty line have a comparatively significant risk for developing to unhealthy aging. Can you go down for the coming to the still down, please. Coming to the bubble graph, we can see clearly that physical dimension, that is the morbidity, being the highest impact on the healthy aging, followed by the economic status and how they are socially engaged, and their literacy status, followed by their mental health and their occupation. So I hereby conclude that the overall health is as a consequence of aging, majority of geriatric people report themselves as healthy. This study shows a dynamic link between multiple dimensions have impact on unhealthy aging, as mentioned before. the physical illness has the highest odds ratio of 27.9, followed by social engagement, which is 22. Then I recommend that whether if the government has a chance to increase the geriatric population to be more digitalized, definitely their feeling of loneliness and other dimensions can be definitely improved, and they can engage ASHA workers for developing, because there are many programs by our Indian government which our geriatric population doesn't even know. So the ASHA workers and other health workers can be made to spread those awareness and make our geriatric population utilize it. Thank you.
Dr. Sarvana Kumar sir, could you please start off by giving your inputs about the research poster?
Am I audible?
Am I
Yes,
audible,
sir.
sir?
Saravana?
Sir,
Okay.
கேக்குதா?
You need start from.
டாக்டர் கேக்குதுங்களா உங்களுக்கு? ஆகாஷ் தான உங்க பேரு?
Yes sir, good afternoon sir. கேக்குதுங்க
குட்
sir.
ஆஃப்டர்நூன். ஆகாஷ், நீங்க வந்து கொஞ்சம் கொஞ்சம் நல்லா பண்ணீங்க. வெரி குட். உங்களுடைய கான்செப்ட்ஸ்லாம் கரெக்டா இருக்குது.
Thank you sir.
இப்போ நீங்க வந்து இப்போ you found you want to see the dimensions இல்லையா?
Yes sir.
எல்லா dimensions on the health. So அவங்களுடைய அந்த how it going to affect their healthy aging. இப்போ நீங்க unhealthy aging சொல்றீங்கல, unhealthy aging what do you mean?
Sir, means that there are sir, their depression couldn't be tackled by themselves, and they are more prone for which are the non-modifiable, certain modifiable risk factors can be avoided, right sir? If they
அப்படி இல்ல, நான் என்ன கேக்குறேன்னா, நீங்க சொல்றது கரெக்ட் தான். unhealthy aging என்ன மீன் பண்றீங்கன்னு
sir, I mean here that sir, most of the geriatric population அவங்களுக்கு healthy lifestyle பத்தின ஐடியாவே இல்லைங்க சார். Just they feel themselves healthy, but they have several problems. But mostly in the rural people, அவங்க unhealthy இருந்தாலுமே most of the times they due to their family issues and certain things, they claim themselves as they are healthy, you know. So that type of unhealthy I'm coming to say.
Sure. What I want to ask is, நீங்க அந்த ஒரு டெஃபினிஷன் இருக்கு, ஹெல்தி ஏஜிங்னா ஒரு டெஃபினிஷன் இருக்கும்ல. இப்போ அதான் உங்களுடைய ரிசர்ச் क्वेश्चन இல்லையா? சோ ஹெல்தி ஏஜிங் உடைய டைமென்ஷன்ஸ் என்ன? அதாவது ஒரு டைமென்ஷனும் அஃபெக்ட் பண்ணுது. சோ அந்த டைமென்ஷன்ஸ் என்ன அஃபெக்ட் பண்ணுது? குட்டா பேடா? அதான் சொல்றீங்க இல்லையா? அந்த ஹெல்த்தினா என்ன, அன்ஹெல்த்தினா என்ன நீங்க கொஞ்சம் ஹைலைட் பண்ணணும். ரெண்டாவது வந்து இப்ப நீங்க நம்ம ஹெல்த் சீக்கிங் பிஹேவியர் இருக்குல்ல, நம்மளோட ஹெல்த் சிஸ்டம், இப்ப நம்மளோட ஹெல்த் சிஸ்டம் வந்து இஸ் ஆல்சோ அட்ரஸிங் டு ஜீரியாட்ரிக் கேர். பட் ஆனா அது அந்த டைமென்ஷன்ல நீங்க எங்க என்ன நீங்க பாத்திருக்கீங்க? இப்ப ஹெல்த் சீக்கிங் பிஹேவியர்ங்கிறது ஒரு டிட்டர்மினன்ட் தானே உங்களுக்கு? ஒரு எனி ப்ராப்ளம், இப்படி நீங்க சொல்ல பிசிக்கல் இல்னஸோ இல்ல மென்டல் இல்னஸோ இல்லைன்னா வந்து வேற ஏதாவது சோசியல் whatever it is, நம்ம ஹெல்த் சிஸ்டம் வந்து ரெஸ்பாண்ட் பண்ணுவோம். நம்ம வந்து we will give them treatment, morbidity-க்கு ட்ரீட்மெண்ட் கொடுப்போம், அவங்களுடைய மென்டல் ஹெல்த்துக்கு ட்ரீட்மெண்ட் தருவோம் இல்லையா? சோ இப்ப கம்யூனிட்டி மென்டல் ஹெல்த் ப்ரோக்ராம்லாம் இருக்குது. சோ வாட் இஸ் த ஹெல்த் டிட்டர்மினன்ட், ஐ மீன் ஹெல்த் டைமென்ஷன்? நம்ம டைமென்ஷன்ஸ்ல ஹெல்த் சீக்கிங் ஆல்சோ டைமென்ஷன் ஒத்துக்கிறீங்களா?
ஹலோ சார்.
இப்போ நம்ம என்ன புதுசா பார்த்து, இப்ப நீங்க
Sir,
கண்டுபிடிச்சிட்டீங்க
yes.
இந்த டைமென்ஷன்ஸ்லாம் அஃபெக்ட் பண்ணுதுன்னு.
Yes, sir.
அதுல நீங்க வாட் யூ வாண்ட் டு மாடிஃபை இப்ப நீங்க சொன்னீங்களா, சூப்பரா சொன்னீங்க, மாடிஃபைபிள் ரிஸ்க் ஃபேக்டர்ஸ்,
Yes,
நான்
yes,
மாடிஃபைபிள் இல்லையா?
yes.
சோ என்ன மாடிஃபை பண்ணணும்னு நீங்க எதிர்பார்க்கறீங்க? என்ன மாடிஃபை பண்ணா ஹெல்தி ஏஜிங் ப்ரோமோட் ஆகும், என்ன மாடிஃபை பண்ணலைன்னா ஹெல்தி ஏஜிங் ப்ரோமோட் ஆகாதுங்கறத நீங்க கன்க்ளூட் பண்ணணும்.
Sir,
Yes.
Sir, first நம்ம அந்த மெயின் ஜீரியாட்ரிக் பாப்புலேஷன் இருக்க ஒரு ப்ராப்ளமே they are not digitalizing, sir. Everything they have to go out, they are not so அந்த phone நம்ம அளவுக்கு they don't know to use it, no sir.
சரி, phone யூஸ் பண்ணா என்ன உங்களுக்கு பெனிஃபிட் ஆகும்னு நினைக்கிறீங்க?
Sir, like so they have chance for getting online consultations. They can get their tablets at their doorstep. Then they can see for the plans available for them from the government side. And new updates can be known.
Phone இருந்தா போதுமா? Phoneல இருந்தா போதுமா? நம்ம ஹெல்த் சிஸ்டம் எதுவும் செய்ய வேண்டாமா?
Yes, அவங்களும் செய்யணும்.
நீ சொல்றது வந்து ஓகே, அது வந்து மேபி டெவலப்டு கண்ட்ரீஸ்ல கொஞ்சம் டெவலப்பிங் கண்ட்ரீஸ் அந்த மாதிரி கண்ட்ரீஸ் நம்மளுக்கு எப்படி இதாகும்?
Sir, we can engage the health workers to create those awareness.
அப்ப நீங்க உங்க ஸ்டடில வந்து அது கொண்டு வரணும் இல்லையா?
ஆமாங்க சார்.
அதான் சொல்றேன்.
ஆமாம். ஓகே சார். Thank you sir.
Thank you, sir.
Thank you, Dr. Sarvana Kumar, sir. Dr. Arun Murugan, sir, could you please give your inputs regarding the research poster?
Yes, Akash, you're able to hear me?
Yes, sir, I'm able to hear you, sir.
Okay, Akash.
Yes, sir.
I'm talking from a different connection.
Okay, sir.
I see that you have actually gone through that document from WHO about healthy aging
Yes.
in a very thorough fashion, and you have tried to script a study based on that. I'm really happy about that, because not many will venture into this domain, and especially I think you did the study way back in 2020, just before the COVID.
Yes.
Right?
Yes, sir.
Okay, fine. So, looking at the way you have structured your topic and the way you've gone through it, everything looks very good. But there are certain issues in that. For example, the different domains which you have taken, okay? Physical, mental, social, educational, and all those stuff. So, which do you think is the most important domain to find a solution?
For this, so physical dimension is being treated by everyone, sir. But here we can go for a social dimension.
So social dimension, what should we do?
We can here, sir, we can engage more into the community, sir, wherever possible.
How? Because you have gone and you have engaged yourself in the community to find out the issues and what are the process which lead to the issues. Now, what do you suggest? How do I engage with them with help back?
Sir, your voice is breaking, sir. Sorry.
You can hear me now?
Yes, sir. Yes, sir.
So now you told me you found out some issues. Now, if I have to go and I have to go and engage with this particular population.
Yes. So you're asking what should we do to engage themselves into the community, sir? Hello?
I'm hearing you. Go ahead. I'm hearing you. You're having some issues, technical difficulties.
Okay.
Go ahead, yeah.
Sir, can we do?
Okay, fine. So The same thing, this topic. Again, if you want to convert this into a program,
Okay.
an implementable program,
Okay.
so what should you, how will you address that?
Sir, here mostly in rural people are mostly they are illiterate, sir. So the program should be targeting to make use even by the illiterates. So there must be definitely a mediator to for between them and the programs, so that our health workers only are the solution to this problem. We should implement a program which can be brought to them or made available for them through the health workers. Definitely, they are not
do we need to
do
we need to give an health solution or a different type of solution?
Sir, a different type of solution. Sir, health. Sir, health definitely.
What I understand, you told me the
Yes.
physical health component is much better, but the social component is a little bit worse.
Yes.
So. Okay, because again, touching all these things, these are all social science and behavioral research and all those areas where the health solutions will have no impact at all. Okay.
Okay.
You need all other line departments to actually work and then find and then give a solution, right?
Yes.
Okay, because again, a lot of students in this age group, you are more focused on the study. But ultimately, what you people should do is you should try to do something known as translational research, where whatever you find in the study should be translated into a public health action. So that is what we look for basically, whether this study can be replicated somewhere or can be converted into a public health action.
Yes.
So most of our questions are in that area. So I think you need to research further and try to actually find out critical issues, maybe focus and find out critical issues in maybe social health and all those stuff, and try to recommend something which can be implemented in the community by any agency. You're not worried about the agency. Let it be an health worker or a social worker.
Yes.
Okay, fine.
Okay.
Now, what made you take this topic?
Sir, the geriatric population is shouldn't be a burden for the country, sir. So we should manage efficiently those populations. So before going into the disease, we can promote their health right from the beginning.
Your answer is very generalized. Sometime back, I asked Apurva, and she said a lot of my friends were complaining and all those stuff. So based on that, I took up this research. So that is much more specific. Yours is a very generalized answer, no?
Sir, the medical expenses can be saved much more if we stop at the risk factor level, sir. Before before they are going into a disease, if we stop that, definitely the investment in the medical system, it will be reduced. The burden will be reduced in the medical system.
By chance, if you're doing the study again and you want to find out something much more specific, will you use the same study design or a different study design?
Sir, a different study design, including a large sample size.
So what study design will you use? What will be much more better to proceed further?
Sir, interventional studies can be done, sir.
Interventional studies. Okay. Thank you, Akash.
Yes, thank you, sir.
Following that engaging session that we had, it is time to call the final participant for the research poster, Kumar, third year BS, ESI Medical College and MSR Bangalore, will be presenting for the final poster. Could you please unmute yourself, Govind, and also project your video so that you can start. We'll be projecting the research poster. Please do unmute and keep your video ready.
Is my audio and video clear?
Yes, it is clear.
Can you please share the poster.
Yes, in a second.
Initially, sorry for the delay from my network connection. I have changed my network connection. If any of these problems arises, please message me. I will change appropriate.
Govind, can you summarize the entire study so that we'll proceed with the question?
So initially, it is a. So I conducted a paper. I did a paper on academic stress and depression among the medical students. It was one of the topics which really intrigued me when I entered my first MBBS. So the main target or the main conflict which I faced was to found a tool or an inventory so that I can assess the stress or depression in Indian students. I found many tools, whether it was for Korean, whether it was for American, or in other nations. But for Indian subcontinent, at the time of COVID, I was not able to find any of these inventories. So before doing the study, I need to make that the tool. I borrowed the tool from HESI, Higher Education Stress Inventory, which was a study done in Saudi Arabia, and also QIDS, Quick Inventory of Depressive Symptomatology, which was a study which was done in Korea. I took both studies. I did the reliability and validity among some of my colleagues here, and after that, I did my studies. So
okay,
yes, sir.
Yeah, you just summarize the results and conclusions.
Okay, sir. So while doing the reliability, the Cronbach alpha value for HESI was 0.9 and QIDS was 0.8. So it is more than the value of 0.7. So it is highly reliable. We can say that both the tools were highly reliable. And initially, if you can focus on the mean value of HESI, it's a scale ranging from 33 to 132. And the mean score which I wrote was 72.3 plus minus 14.7. So it's a higher perspective. Similarly for QIDS also, as 1 to 27, I got a mean score of 7.8, which was found to be highly important. Coming to validity measures, the first step which I had done was the Spearman correlation. It's a conversion validity. So the amount of students who are saying they have high stress have found to be highly of depressive symptomatology or in the higher stages. It was positively correlated. Similarly, for structural validity, since HIS is a 33, I mentioned that in the right side in the figure 2 radar chart, and I was able to present 56.08% of the variance in this manner. And predictive validity I also did. I need linear regression ANOVA was also done. So that we said that increasing in the stress scores and also increasing in the depression scores from linear regression from ANOVA inter stages. For example, what I was trying to say is that I divided the stress scales into mild stress and moderate stress. The amount of students who are setting moderate stress is more than that of mild stress. So there was from my post hoc test. So these were my reliability and validity measures. The tabular chart is mentioned in figure 1 and figure 2. If you want, sir, I can go deeply in that portion, sir.
No problem. My first question to you, isn't this too much for an undergraduate?
Yes, sir. The main reason I took this topic was I want to, first year when I was writing my exam, I see one of my friends was plucking her hair. I asked her what happened. It's too much stress for me. So that was my first step. I need to study what was the stress. Like how much stress is happening in a medical student. While going back home and searching about the stress, I found out 1/3 of the students have in the medical field was found to be highly stressed, which was published by WHO. So the main question that struck me was, if in 100 people, 66 people were able to cope up with this, only 33 people is doing this. So what exactly are these 66 people doing so that it will not happen to these 33 people? So that was my major paper. I did that paper, research paper. So in that paper, my first hurdle, which was to find a reliable tool, sir. So I have spent months finding a tool and in reliable, and I've done a lot of this in this. That's why, sir.
So what I've understood is you have understood what is Cronbach, what is Spearman, what is linear regression, and what is ANOVA with post hoc also. So all these things you have understood, and these are some statisticianality.
So I have my help from my statistician from my college, but I understood reliability. I done personally myself. And linear regression, I know it was quite tough for myself, and I know that, sir. But other part, I really understood, sir.
Okay, fine. So now, based on this, you said you found out around 30% were facing depression, right?
Yes, sir.
Okay, so is there any other easier way to find out whether 30% are facing depression? Have you taken a complicated route?
Easy methods, I used to Google, like many of the people will not be answering honestly, sir. Even though the main reason in my Google form, I haven't asked anyone of the name, nor the age, nor the year. I only asked which college you're from. That's why I'm expecting the values which I get, getting somewhat more believable. Because if I'm personally going and asking someone, they will not do. They will not say honestly to me if they have stressed or not. So going in this, I know it's a quite twisted route, but I think if going by this only, I will get the honest answers from each one of them. So that's why I went like this.
So if you think all the answers which you have received from those people are really valid and reliable?
Yes, sir.
From a statistical point of view?
Yes, sir.
Cool. Who's your guide?
Sir, Purabi ma'am, Dr. Purabi Bukkan, sir.
Okay, fine. So, but I took the liberty of calling you the Bangalore guide because your the professor as well as one of your associates are a very good friend of mine. But I'm really impressed with your study. Not many questions I have. Maybe personally, when I meet you, I might have some questions. So I had certain doubts, but you had explained those. You had gone an extra mile to explain whatever the thing is there in your study, and it has cleared those doubts also. Good. I hope that you continue this thing. Again, having a research mindset like this to try new niche areas, I think the research community will benefit lots from you. Okay, thank you.
Thank you, sir. Thank you so much, sir.
Dr. Sarvana Kumar, sir, could you please provide your inputs about the research poster?
Yeah. Doctor, your presentation was good, okay? You had only summarized and all these things. I just want to know, you are testing a tool, no? For reliability, yes, as well as how far it is going to be reproducible and how far it is going to be useful. And how do you, what is the gold standard you have kept?
Sorry, sir?
Gold standard.
Sir, mainly I have used three tables, sir. One, like since this study was during COVID-19, I like on the phase of April 21 during the COVID phase. So
okay.
I took these three tables, that is HESI. From HESI, I took one, from QIDS, and from this COVID questionnaire, which I have not been projected here because it is not in this part. And with comparison to the scores which was produced from the initial authors, HESI was already initially done by a professor from Saudi Arabia. So comparison of that values I have done this.
Okay. Now, how as professor asked same question, how do you know that the reply, the response, what the participants have given, how do you cross check it? How do you take it for granted? So you are able to say that 1/3, 2/3, no?
Yes, sir.
So how do you, I mean, high level of stress you have concluded, no? So how do you correlate and how do you confirm that this is there? So with this study results, can we design a program to de-stress the medical students, or do you want to do anything?
Definitely, sir. I'm planning on doing something, but I can't completely confirm this, sir. Since I have sent this to more than 18 colleges across 8 states, with the help of the professors in the respective colleges, I have contacted them. Because being a sensitive topic, it is impossible to directly talk to them or like let their value. So
Yeah,
being in an indirect way, I can get this.
I agree with you. The methodology, everything is correct. I just want to just only ask, how do you cross-check what is the gold standard that this is really a high level of stress among medical college students means? It has to be, for example, dealt at a health fee. We are people who are going to deliver health to the community. Correct. If we ourselves have an issue which is of high magnitude, that becomes a really important question of interest. That's why I'm asking you, if this study is submitted for research, for example, some ICMR or some other projects where they have mental health issues. This is a mental health issue, no, among medical college students. Good. The attempt is good. What I want to ask is, if you produce high level of stress as the conclusion, what the question will be asked is, how did you confirm it? And I mean, is this high level of stress on the health impact on their school, I mean, academic performance, and is that really a burning issue or not? So that you have to, in your future study, please highlight how this will be confirmed, what will be the gold standard to say this is a real issue. Your instrument picks up a problem, how far the instrument is reliable and how far it is going to be, you can recommend for an intervention. See, ultimately your study is to recommend some intervention, correct?
Yes,
you need some intervention, some counseling sessions or de-stressing. Why should medical college students have a lot of stress? So whether it is because of their academics or because of their future, what is that makes them stressful? And finally, I want to ask you, are you having any stress or Any depression?
So firstly, I can say that I'm in every medical student is in a stress, sir. I mean, whether it may be academics or whether it may be financial issues.
What stress you have? I just want to know what is the stress you have, dear students? What is the stress you have? Exam stress, or what is that you have stress? I want to know.
For that, can I take some? I need to say one thing, sir. So in the figure 2 chart, there is a small radar chart, sir. The major concerns with the students approached, the 8 factors, which was mostly done was this, sir. Out of which was found out to be that lack of time for recreation and academic stress was found to be the most stress factor for the medical students, and commitment and satisfaction related to the medical course were the least one. So being one among these, I will be also saying the same, sir.
So you want to have some program where they will de-stress medical students, have some recreation, all these things. No?
Yes, sir. I approached this result with the dean of my college.
Good. What you're saying is correct. I just want you to highlight in your future study, carry on the study and come out with a something like a recommendation. What can be done to reduce this high level of stress and depression, whatever it is. You have put very good, no, negative student attitude. Why the student is having negative attitude? And what is the personal reason? Yeah, like that. Just want to highlight. Okay. Just telling you.
Yes, sir. Okay.
And you do financial concerns, what financial concerns they have. And sometimes, no, see, if you are coming from, for example, a different language, and you're coming to a medical profession where you're exposed to the new language, English, you may have a lot of stress on this. But already you people have a lot of stress in +2. I think +2 is the most stressful period. Even that itself you have crossed, no? And why should you have stress in medical? You understand?
Yes, sir.
See, deciding life is very important. +2, the 12th standard, no, you decide your life. So you take this direction or that direction, correct?
Yes, sir.
So right or left, for example. So that even that stress you people have overcome. See, actually, medical college students are supposed to be the cream of the students in the school. Am I right? So
Yes,
every
sir.
child, if we ask, no, first standard, LKG, 5th standard, what will they say? What do you want to become? They will say doctor, correct?
Yes, sir.
Yes or no?
Yes, sir.
Everybody will say. Nobody says, very few will say, I want to become pilot, I want to become that. But many will say, I want to become a doctor. So imagine that is the dream of everybody. In the school life, we have a stress. But even in +2, you people have come out, no? Correctly?
Yes, sir.
Correctly speaking, medical students got a lot of, you're supposed to be the cream. So if you, the cream itself, themselves have this issue, then we have to find out what can be done, because it is a very important, because your future physicians, your future doctors. So your study is good. I just want you to highlight what is the thing, why they are stressed out, how to de-stress them, all those.
Sir, may I add one point to that, sir?
Yeah, please.
Sir, even though, as I explained, we are the cream of the society, I done the survey among 539 students exactly. And out of which, I get a result that 8 people are planning to suicide, sir. It was a risky question, it was a risky attempt which I took. It was under my, are you planning or have you planned to do suicide? It was one question which I asked them. The responses out of 539, 8 people said, like, if comparing 100 as one batch, more than 1 people in one batch is saying they have thought of suicide after entering the medical course, sir.
Okay, good. So you highlight this and try to find out in future what can be done. Okay.
Yes, sir.
Good. Thank you.
Thanks.
After that interesting and interactive session, it is time to bring us to the end of the research poster. We'd like to thank all the participants wholeheartedly for their sincere effort and participation in this competition. More so, we'd like to thank our judges, Dr. Arun Murugan sir and Dr. Sarvana Kumar sir, without whom this research poster would have not been so engaging. The results for the research poster will be announced in the evening session. Following this, we'd like to move on to the next leg of the event today, which is the essay writing competition. I'd like to briefly introduce our judges on the panel today, Dr. JANKIRAM sir and Dr. MEERA ma'am. Dr. JANKIRAM sir. Dr. JANKIRAM sir is currently the Deputy Director of TANSACS, and he's the Nodal Officer for Hepatitis Surveillance Program in Tamil Nadu. More so, he is an avid teacher who has a panache for teaching overall. He completed his MBBS in Teni Medical College and his MD in Community Medicine in Stanley Medical College. Glad to have you on the panel today, sir. Next up, we have Dr. Meera ma'am. She completed her MBBS from Coimbatore Medical College and her MD in Community Medicine from Stanley Medical College. Out of the many feathers in her cap, she was the runner-up in the IAPSM National Quiz 2020 and has bagged the first prize in the poster competition on the World Zoonosis Day conducted by the Tagore Medical College. Glad to have you on the panel today, ma'am. We'd now like Dr. Jankiram sir to talk about the essay writing competition. We'd like to hear a few words from you, sir.
Thank you, Doctor. First of all, my best wishes and hearty congratulations to the organizers from Department of Community Medicine, which is headed by Dr. Arun Murugan sir, who is my teacher, and other faculties there, who are all my friends and colleagues. So first of all, I'm conveying my congratulations to the organizers as well as the students who have arranged all the things in an effective way, and my best wishes for them to make this event a grand success. Regarding the essay writing competition, how I am approaching this essay writing competition is essay writing is a prejudice for a proposal writing. So if you are good at writing some proposals, means whether you are proposing it to a girl and getting a okay from her, it starts from there, and it may finally takes to you another level at getting a proposal from WHO and getting a proposal from multi-funded multi-organizations where they used to provide a lot of funds. So I'm taking this essay writing competition in that way only. So my best wishes to all the participants who have participated in this competition. First of all, I was given a chance to review 5 different essays, and the participants have taken it in a serious way, and they have written it very well. First of all, regarding the participants, I think I'd like to share some few points about few of the participants. Dr. Pooja Sri Ramula from Government Medical College, Mahabub Nagar. She has written that essay with in a comprehensive manner. She in her essay she has written all the points, like starting from the WHO till the role of other stakeholders in this One Health system. Likewise, she has mentioned. And regarding Dr. Swatika and Dr. Sandhya, the organizational structure and the component of the essay was very good, and I love the thought process of both these candidates, and they have mentioned and they have correlated the lifetime events in the essay with suitable examples. So I'd like to congratulate both of them. In my perspective, I would like to convey certain things. You have to write the essay like a screenplay. Maybe there was a famous movie which was taken by Mollywood called as Virus, where the screenplay writing was taken at a different level. Like that, our college essay writing, in this essay writing competition also, I hope the people will start doing screenplay writing kind of work when we are taking the examples from the lifetime events. Means it will be it will even become a good screenplay. So I congratulate each and everyone. I once again thank the organizers, starting from the students to the faculties, who have arranged all the things in a in a grand way to make this program success. Thank you one and all.
Dr. Meera ma'am, would you like to share your thoughts regarding this competition in Ignozia?
Good afternoon, sir. Am I audible?
Yes, you're audible.
Good afternoon,
Dr.
sir.
Meera ma'am.
Yes. First of all, I want to thank my professor, Dr. Arun Murugan, sir, for giving me this opportunity. And I have gone through the essay writing of 5 to 6 participants, and overall the presentation was very good. I have to congratulate all the participants who have made immense effort. Being in the undergraduate level itself, you have did so much effort and put hard work. Today, I'm going to highlight few important points did by Dr. Arun Annamalai, second year medical student from ESI, KK Nagar, Chennai. Your overall presentation was very good. You have highlighted the important keywords wherever necessary, and at the same time, you have added pictures. You have highlighted and added the pictures, which is one of the key feature of your presentation. And you have highlighted the global scenario, and you have compared the concept of One Health, and you have subdivided the concept, and you have highlighted its impact on various aspects. So your presentation shows that you have did so much work by doing literature review, which is your depth of understanding is also highlighted in your presentation. So I want to congratulate you. And another presentation by Shivani from Keith Park Medical College. You have explained the concept of One Health in a very comprehensive manner. You have divided the concept into multiple subheadings, and you have highlighted the points, and you have added some quotations and quotes. You have added the quotes, and you also mentioned some global scenarios, and you made some effort to compare it. And you have explained all the concepts very briefly. You have tried your maximum effort to explain it in a very comprehensive manner. So overall, the presentation by all the 5 to 6 participants was very good. In the undergraduate level itself, you are putting so much of effort. So I want to congratulate everyone. Thank you so much for giving me this opportunity.
We'd like to immensely thank Dr. Jankiram sir and Meera ma'am for their valuable inputs and the efforts they've taken to judge this competition. The results of all the 3 competitions will be announced in the evening. On that note, we'd like to break for lunch, and we request all the participants to reconvene at 2 p.m. and we request them to rejoin again at 2 p.m. Thank you all for your cooperation and time.
Thank you.
A very good afternoon to all of you. We'll be starting in a few minutes. We're waiting for a judge to join. So kindly be on the call. This is a message to all the participants who are currently on the call. We'll resume in a few minutes. A very good afternoon to all of you. We are now in the post-lunch session of the Ignozia event that is being conducted by the Department of Community Medicine, OMANDURAR Medical College. It is now time to move on to the next event, that is the scientific poster. The great Newton, who's hailed for his achievements, started off with a simple discovery of an apple falling from a tree. And this proves that the complexities of science are born by the fact of simple research. More so over scientific research. Hence, taking this as a great segue, I'd now like to introduce the esteemed judges on the panel for the scientific poster, Dr. Chitra ma'am and Dr. Kanchanamala ma'am. Dr. Chitra ma'am is a professor in community medicine from the Madras Medical College. She has national and international journals to her credentials, and she's a former planning expert for the NRHM, and she's a national and a state level trainee for various public health programs. We are pleased to have you on our panel today, ma'am. Next up, we have Dr. Kanchanamala ma'am. Dr. Kanchanamala ma'am has completed her MBBS in 1992 and her MD in 2010, and has also completed her MBBA in the year 2018 from Anna University, hence being a multi-degree holder herself. She also has a degree in M.Ed Family Medicine from CMC Vellore and is also a gold medalist PhD from the Indira Gandhi National Open University. Again, we're pleased to have you on our panel today, ma'am. On that note, may I now pass it on to Amitesh, who will now be giving a few instructions regarding the competition.
So regarding the instructions, it will be similar to the morning session. We will be projecting your poster. You will be explaining your poster for a maximum of 7 to 10 minutes, which will be followed by a discussion session by the judges. You'll answer the question and then we'll move on to the next participant. Kindly keep your net connection secure so that we'll move on to the session. Thank you.
To kickstart the competition this afternoon, I'd like to call upon Ilayamati, who's a CRMI from the Karpaga Vinayaka Institute. Ilayamati, we've already projected your poster on the screen. If you could please turn on your audio and video, we could listen to you and you could start presenting.
Can you see my video, ma'am? Hello?
Yes, ma'am.
Am I audible? Can I see you?
You're audible.
Yeah. Okay. First of all, good afternoon for everyone. I'm Ilayamati, CRMI from Karpaga Institute of Medical Sciences. Thank you for giving me the opportunity to present the topic scientific poster on healthy aging, adding life to years. Okay. First of all, what is healthy aging? Healthy aging is maintaining a physical, social well-being throughout one's life, especially in the later life. The main goal of a healthy aging is disability and disease-free life with high physical and cognitive function. So, what are the aging determinants? See, aging even starts before when we know, like aging is not only after 60 years, it starts even in the younger years. Okay. Now coming on to determinants, we have positive determinants, negative determinants, miscellaneous and modifiable. Positive is better physical health, mental well-being, financial security, independence, good social connections, friendship, vegetarianism, spirituality, and community participation. Good physical fitness in the sense like exercise plays an important role and the diet plays an important role. And negative, we have poverty, illiteracy, lack of care, insanitation, broken homes and families, and malnourishment, etc. Miscellaneous, the genetics has an impact on aging also. Addictions, healthcare facilities, income, and environment also plays an important role in aging. Some of the modifiable factors on aging are sedentary lifestyle, environment pollution, personal hygiene, smoking, alcoholism, dietary intakes, sleep, immunization, hormone deficiency. Like in older ages, estrogen deficiency state may occur, progesterone deficiency may occur. These can cause osteoporosis and related illnesses. Okay, next. Coming on to how to age healthy. I have made a simple poster like with the pictures how to age healthy. Like first of all, we should start practicing in the younger age itself, like in the early years. Not see after aging, if we exercise, we'll be younger. It's not like that. We should start even before the years. Okay, first exercise. Get moving. Try gardening, biking, walking, etc. And healthy diet plays an important role. There is a plate called Harvard Healthy Plate, which suggests that you take an entire plate and divide into half. In that one half, you divide into two equal parts. First part should have most of the cereals, and the second part should contain pulses. In the other half of the plate, 3/4 should be vegetables, and the 1/4, rest of the 1/4 should be fruits. This is a Harvard Healthy Eating Plate. And have regular checkups, visit doctor regularly. Like in older ages, screening is most important. For example, pap smear screening for carcinoma cervix and mammography for breast cancers, etc. And manage your stress by trying yoga or keeping a journal. Connect with families and friends to maintain a good social relationships. Okay. So physical fitness plays an important role. Aerobic and resistant workouts improves our memory. Also develop many neuronal connections in the brain, which keeps our mental health healthy. There is a term called neuroplasticity, wherein the brain develops new connections. This exercises for the mental health may delay for the Alzheimer's also. Okay. There are 5 simple tips for healthy aging. First is healthy nutrition in a simple, and prevention by regular health checkups and walking of 150 minutes a week and exercise 2 days a week. And relationships have a good community maintenance. And the last thing, you should not feel bad about being old or getting aged. First, you should learn to accept the thing that you're aging, and you should embrace and focus mainly on the positive aspects of aging. Okay. So, next, coming on to the statistics, why I took this topic, and I feel this is more interesting and important because there is a statistics in India showing that there are 300 million elderly people by 2050. This is 30 years from now. Today, it's about 104 million old age people in India, but it is expected to rise, not today, in 2011. Okay. It is expected to rise about 300 million in 2050. And important thing is that the old age people living in our country is equal to the entire population of the USA who's there. So I feel that our country has most of the old age people, and this education about how to live a healthy life should start early itself, in the earlier life, and not only on the not only towards the old age people. Okay. And in prevention, like if the people who's in old age, if they have any ailments, we have some prevention strategies also, like the proper facilities, health facilities, and the care towards the old people, and the regular screenings, checkups, and providing many community health centers to give them advice about healthy agings, and asking them to quit about the addictions, drugs, alcohol, tobacco, etc. Okay, thank you.
So good, Ilayamati. Can we have some discussion on your poster?
Yeah, sure, ma'am.
Yeah. And one point very interesting to me from your poster is the positive vegetarianism. Why is that you specifically want to mention that?
Yeah, vegetarianism plays an important role here, because nowadays the chicken or the non-vegetarian diet is not like properly, it's infused with some of the chemicals, like broilers chicken have some hormones intake which have a great impact on our lifestyle in the younger age. It may cause PCOS and related factors also in the younger age, which may not have direct impact in the younger days, but it have indirect impact on the older age people.
But what about the proteins and the other vitamins which we get from the non-vegetarian food? So how will you compensate for that?
Yeah, in vegetarian food, also we can compensate for that, ma'am. Like proteins are rich in vegetarian foods also. We can make a change consuming those things.
So that was one point that in fact attracted me. And you also said for prevention and points related to that, go to doctor regularly, choose healthy foods.
Yes, ma'am.
Okay, so do you think all this is possible in the aged population that we have? Are they economically independent?
Yeah, so that only I feel that is more important to educate people from now onwards, like in the 30s, 25s, 30s and all. If we start health educating them, it will be more reachable when they become old. So, so I say that health education for healthy aging should not start for should not be only for the old age people, but it should start in the earlier life itself.
Hello.
Yes, ma'am.
Ma'am, Chitra ma'am, may I ask a question, ma'am? Ilayamati.
Yes, ma'am. Yes, ma'am.
Ilayamati.
Yes, ma'am.
Just you have mentioned in the healthy aging,
yes,
as optimizing the physical, cognitive, and mental health.
Yes.
Okay. Physical, cognitive, and mental health. How will you optimize? Can you just brief?
Yeah.
How will you optimize? How do you think you can optimize?
Okay. Physical health is like the physical fitness, having a proper BMI, regular exercises, walking 150 minutes a week, and exercising twice 2 days a week. And physical fitness is really important. And cognitive is that having some mental
How will
exercise.
you actually define cognitive health? How will you define this terminology of cognitive health? You mean to say it is cognitive health, no?
Yeah, yes, ma'am. It's like the brain exercises you're gonna get. Cognitive health mainly plays an important role in prevention of Alzheimer's and all. Like.
So, and what do you think you focus when you say on it is mental health? How is cognitive health different from mental health?
Yeah, mental health has a greater connection with the social health also. Like loneliness is an important thing which we are gonna face when we age healthy, when we age old. Like by creating strategies and facilities for loneliness among the adults, like old age homes and rehabilitative clinics and counseling facilities for the old age people can make a change in their mental and social life.
Have you heard of the terminology cognitive reserve?
Cognitive reserve.
Cognitive reserve?
No, I'm not sure about it.
Okay. So, how will you differentiate between cognitive health and cognitive reserve? See, cognitive health is mainly concerned with how you are able to keep your memory intact and how you are able to perform the higher functions. Okay.
Yeah,
so, with regard to cognitive reserve, is how we are able to preserve our function. So, it is mostly you should promote cognitive reserve. So, how we are able to maintain the cognitive reserve. So what you will be concentrating during this development, maintaining the cognitive reserve is how we are able to keep the information intact within you and how we are able to comprehend them and how we are able to comprehend the relationship. That is a more complex pathway than just have cognitive health. So cognitive reserve is more important and you will have to preserve the cognitive reserve during old age rather than having just to have a cognitive health. So cognitive reserve would be a appropriate terminology when you talk in terms of preserving the preservation, that is maintaining a healthy lifestyle or maintaining a healthy cognitive lifestyle and mental health during.
Okay.
So one last question from me, Ilayamati. What is one intervention if you would suggest for healthy aging? Just one intervention if you would suggest.
The intervention is not going to focus on primary, secondary, or tertiary. It should be like before itself, the primordial interventions. Before one start getting any ailments or diseases, health education is the most important thing. I feel like personally, the education should start even before 20s itself, ma'am.
Okay, thank you.
Thank you, Ilamati.
Following that fruitful discussion, we'd now like to welcome the next participant for this competition. Mridula M, a third year MBBS student from Madras Medical College, will be presenting next. The poster will be presented by us. So please do keep your audio and video on.
Ma'am, am I audible?
Yes, Ma, go ahead.
Yes.
Ma'am, actually, I have no power right now, ma'am. So, am I visible?
Yes,
Mridula, you are visible. You can continue, Mridula.
Okay. So, good afternoon, everyone. Good afternoon to the respected judges and my fellow participants. My name is M. Mridula, a third year medical student of Madras Medical College, here to do a scientific poster presentation on digital health and its transformation in healthcare. Let me give you a brief definition of digital health. It is nothing but an intersection between between health and technology to provide an equitable, affordable, and accessible healthcare system. So, what is digital health? Digital health is a discipline that involves uses informative and communicative technologies in order to enhance the efficiency of healthcare to make medicine more personalized and precise. So, some of the examples of digital health, why it is important to discuss digital health is that it is India is in the adoption of the health technology with 76% of its healthcare professionals using digital health records in their practices. So digital intervention in healthcare is expected to compound annual growth rate according to the Indian Brand Equity Foundation. So we can say that India is at the very cusp of digital health revolution. So it is vital to discuss it now. So there are very many examples of digital health like wearable tech, telemedicine, genomics, virtual reality, robotics, and artificial intelligence. And wearable medicine and health apps are being a trend right now, as it gives us a continuous analysis of the um, quantity as well as the quality of physical work done by the person, and it also allows the patient to make control of their health at a given period of time. And telemedicine is another branch of digital health, which is also a fast growing sector where communication technologies and electronic information are being exchanged in order to provide digital health. For example, like video consultation with specialists. The benefit of telemedicine is that it reduces the consultation time. Next, we have artificial intelligence. Artificial intelligence also plays an important role in digital health as it behaves as an administrative workflow assistance. That is, it converts the complicated tasks such as entering the patient information into automation. It also helps in diagnosis of diseases and developing and discovering new drugs for diseases, because artificial intelligence algorithms help navigate the patient records, medical records, and also the clinical trials, and then helps us in discovering the novel medicine for the diseases. Next, you have robotics. Robotics helps us in transforming surgeries, such as it helps the surgeon in assisting with greater precision, and it also reduces the post-operative complications, and it also has faster recovery of the patients. So let us move on to some of the benefits of digitalization. So I have mentioned here a few benefits of digitalization, such as it reduces the inefficiency in healthcare and improves the quality of healthcare. how does it reduce inefficiency? By improving the healthcare processes by faster emergency services, and there is self-monitoring and a product patient safety. And it also lowers the cost as the patients have access to an easily available and a flexible clinical care, and the patient, and also lowers the cost for the medical professional as well as the patient, as the patient can remain at home and can access the clinical care. Next, there is personalized healthcare. Personalized healthcare, like wearable devices and also DNA sequencing, can help us help the doctors in diagnosis of the patient with the risk factors that can help prevent the effects of the disease. Digital health is now redefining the healthcare system with the use of analytics, that is, decision making and predictive dashboards in order to predict the earlier signs of an outburst. It helps in the caseload prediction and also disease control. So let's move on to some of the organizations in India which helps in promoting the digital health. This is the Indian Digital Health Net, which is an Harvard and research policy collaborative organization which is involved in development of an API-enabled healthcare ecosystem. API is application programming interface, which is collaborated with this organization involves policy making with Harvard universities. So how the digital health promotion is being done? The various domains of our healthcare system includes the PHCs, hospitals, registries, research, and policy. And steps are being taken at each domain in order to promote the digital health. These include digitalization of the PHC ecosystem, hospitals like building API on existing electronic health records, registries, and standardization of the curriculum, research and exchange fellowships, and curriculum development and policy recommendation. As I've already discussed, artificial intelligence and machine learning also helps in scanning this X-rays, identifying the disease, and notification to move users towards behavioral change. Machine learning is also another subtype of artificial intelligence, which is defined as the ability of a machine to mimic the person behavior. Another organization is a PATH, which is an abbreviation for promoting technological health in India. It is a global team of innovators working to accelerate health equity. So the main goal is to digitalize health in India using a patient-centric and effective one. So what are the approaches? The major approaches is optimizing and customizing solution to the problems at hand. And it is a human-centered design, meaning that the patients are the center for their problem-solving solution. That is, the voice and perspective of the patients are taken into account and solutions are being made in order to meet the needs of the patient. Next, you have the collaborations and partnerships with companies, which are imperative for any healthcare system to function. And next, we move on to the roles of the professionals. Professionals play an important role in healthcare system as there are doctors' digital work. These include dashboard to predict the early warning signs on outbursts that I already discussed. There are also other modalities like data science, user research, and clinical advocacy. And there is market assessment, which are being done by the healthcare professionals in order to promote the digital health. And in COVID-19, there was digitalization to effectively manage oxygen ecosystem. Initiatives taken by the Indian government include the Ayushman Bharat Digital Mission, which is a national tele-mental health program. And it's another program, is National Tele-Mental Health Program. The COVID-19 initiatives include the COVID, which was a tech backbone for vaccination drive, and National Digital Health Mission. So I'll conclude my session by saying the future endeavors and our conclusion. So as health professionals, we should overcome the challenges faced in digital health, such as interoperability, cybersecurity, privacy, and challenging misinformation. By embracing digital transformation, companies can exploit technology and communication to harness growth and profit, which is bound to have a positive impact in life. Thank you.
Be ready. Dr. Chitra ma'am, would you like to give your
Yeah.
inputs regarding her poster?
Yes, ma'am. So Mritula, so this was a nice depiction of whatever you described. You had put it in a nice way in your poster also. One question from me is, what do you think are the enabling factors and disabling factors in our country for improving digital health?
Ma'am, enabling factors are the fast-growing internet service around us, ma'am. We can make use of it, and there are people who technological related peoples are available everywhere. We can train people in digital health and provide awareness about them. And disabling factors, maybe the awareness is not. We are not utilizing the digital health as such. Now. We are not aware of its
Dr.
we can
Kanchanamala
reduce
ma'am.
the cost as well as.
I think we've lost our connection.
Yes.
Yes, ma'am. Am I audible? Ma'am?
Yeah. Continue.
Yes, ma'am. That is the disabling factors or the awareness is not being spread, and digital health can help us in so many aspects. Like it can reduce the time duration as well as the it can give early signs of a patient. Also helps in early diagnosis and patient friendly and these information has to be known by everyone so that people can come to know about this. And,
Okay. Thank you, Mritula.
Okay.
Yes, Dr. Mritula, can you just give me an example of how the role of professionals in preventive or promotive health, how they can use the digital health platform? One solid example where the professional can play a vital role
there is
as a preventive or promotive care.
Ma'am, we can promote digital health like by data science and use of resource, ma'am. Like they can, there are developing strategies in order to analyze the data, and we can also, create content creation. Like you can create contents related to the diseases and also their treatment in and product development. And as I've already said, clinical advocacy, like we can do activities in order to improve the access to healthcare by the healthcare professionals. And we can also try to bring out the health inequities which are met in healthcare system. And we can also assess the importance of, and we can also and navigate
what the primary healthcare physician or the you are going to be the critical care like the primary physician of care in the community. So how do you think you can play an important role in serving the community through the digital health process? Just give an example for that.
we can electronic and there are electronic and medical health records, ma'am. So we can which involve the digitalization of the patient's information in a single place so that we can get access to the patient's medical records. And so there are AI algorithms that will help us bring the patient records and through research or clinical trials. And clinical trials also play an important role in digital health, ma'am. And these help
I will give you one example. I will give you one example how the digital health can transform your way of managing things. You can, through the gadgets available, you can record the ECG and you can just read them wherever you are, and you can just send the care to the patient's area, and you can pick up the patient. So this is one sort of thing. And there is one thing in ophthalmology department which is being one private institute has taken up the initiative of screening the patient's eye. So the screening patient's eye, it is done in the PHCs. There will be just a computer there, and they'll be screening the eyes there, and the records will be sent to the institute, and they'll be diagnosing, and early stages of diabetic retinopathy has been detected like this. So this is how the digital health is helping us in providing better care at the primary at the community level. Okay, so we are taking care to the community level. We are picking up the high risk patients, and we are providing them the care that is needed. So this is one thing. And you have described yes.
So like using AI algorithms, we can also detect the prescription practices, ma'am. Like if the patient if there is any deviation from the typical prescription practice, like prevent overdosing, and we can also do that. And there is also the wearable devices which give us the information about the patient at the time of any illness or something, and it will give information to the doctors as well. So all the devices are being connected at a single place so that the doctors get the information.
Using analytics, you have described about the use of analytics. So analytics, you have talked about the decision making and your how we can predict the diseases. And anything else you want to add in analytics? How you can use the analytics, which is appropriate which was appropriate in the when you have a big epidemic or an endemic situation? How we can use the analytics? Are you able to get my question?
Yes, ma'am.
You have talked about the disease control measures and prediction, the caseload prediction, all that you have talked about. There is another important, more simple thing, primarily more important thing that is useful in case of analytics, which was more useful to us in the epidemics or when there are cluster cases. Disease surveillance is very important. Okay, so surveillance is very much easier with analytics. Disease surveillance is of paramount importance, and it can be easily done with the use of analytics. Okay. Okay. Thank you, Nodal.
Following that interesting poster discussion, let's now move on to the next participant. Padaleswara Ratnam, a second year MBBS student from Govt. Tiruvannamala Medical College, will be presenting the poster next. The poster will be projected by us. So please do switch on your video and audio and be ready. Following an unprecedented issue in connection, let's move on to the next participant. Shazia Mohsin, a third year MBBS student from the Govt. Tiruvannamala Medical College, will be presenting next. We shall project your poster. So kindly be ready with your video and audio.
Good morning to everyone present here. I am Shazia from Govt. Tiruvannamala Medical College, and I would like to present my poster. So my poster is in the topic healthy aging, adding life to the years. So before I start talking about healthy aging and the factors which contribute to healthy aging, I'd like to talk a little about geriatric population. So geriatric population clinically refers to people who are above 65 years old. In some parts of the world, they consider it as 65 years, and in some parts, they consider it as 60 years. Globally, this geriatric population constitutes about 9.3% of the total population. In India, they constitute about 8.6%. This geriatric age group has been increasing significantly due to better healthcare services. But even though the lifespan of the people is increasing, there has not been much life in those years because they lead a very uncomfortable life. This is mainly happening because of this epidemiological transition. So before it was the age of pestilence and famine, then it became the age of receding pandemics, and now finally it is the age of degenerative and man-made disorders. So because of this epidemiological transition, there has been reduced deaths in early age, but it has reduced the quality of life for the elderly. And these elderly people suffer from many degenerative disorders and complications. Some examples of these degenerative disorders are atherosclerosis that causes hypertension, coronary artery diseases, cerebrovascular accidents, etc. And these can also lead to long-term complications like paralysis in case of stroke. Cancers are also seen in the elderly, which the cancer itself and also its treatment can lead to morbidity and mortality. Osteoporosis is another problem faced by the elderly, especially in females. It makes their bone fragile and makes them prone to accidents that cause fractures, like for example, fracture of the neck or femur. They are also susceptible to osteoarthritis and the spondylosis of the spine. Apart from all this, the leading cause of morbidity and mortality is diabetes. The complication of diabetes like microangiopathy, neuropathies, nephropathy, retinopathy, there's an endless list of complications due to diabetes, and it makes the life of elderly people very difficult. Eye disorders like cataract, glaucoma, and ear disorders like deafness is common in old age. Some mental changes also are seen like dementia, dislike of change, loneliness, and depression. In case of women, menopause also is a very difficult phase for women because they experience many physical and emotional disturbances and changes. So I made this poster to elaborate the factors which contribute to healthy aging and to minimize all these degenerative disorders that I just talked about. So the first and most important factor is diet and nutrition. Diet and nutrition is an important necessity for a healthy lifestyle. In older days, undernutrition used to be a problem, but now this problem has been replaced by overnutrition. This overnutrition leads to non-communicable diseases such as obesity and metabolic syndrome, diabetes, hypertension, PCOS, etc. More than overnutrition, the problem has been fast food. So these fast food contain trans fatty acids, so much salt, sugar. So trans fatty acids can increase cholesterol levels and cause atherosclerosis. Salt and sugar can cause hypertension, diabetes. So reduction in all these fast foods will lead to a healthier and longer life. And also apart from all that, eating a balanced diet, high fiber diet with many fruits and vegetables and calcium rich foods should be encouraged in the geriatric population to increase the health in their life. Apart from that, smoking is also a major cause which causes cancers, as I already told. It's a major cause of morbidity and mortality in the old age. And also respiratory diseases like emphysema can be seen because of smoking. Non-smokers usually live a longer and healthier life. Alcohol consumption also causes many problems like liver cirrhosis, liver cancer, stomach ulcers, gout, depression. So this is because in old people, they are more susceptible to alcohol toxicity. The concentration of alcohol in blood is more for them than in young people because the enzymes don't work as well as young people. And these people have lower tolerance for alcohol. So all these effects of alcohol are more in the older people. Then after diet and nutrition, we'll go to physical exercise. Physical exercise also comes under the component of physical health. Not just eating right, but also exercising or walking every day is the best way to keep our body healthy. The sedentary work and lifestyle which people are having nowadays has led to all these non-communicable diseases that I talked about. So sedentary lifestyle is the main reason for all these problems that the geriatric population is facing. So we should they should make it a habit to at least incorporate some time of the day towards exercise and walking. Other factors are environmental factors. In environmental factors, it mainly pollution, because pollution causes many free radicals in the environment that can hasten the process of aging. And The genetic makeup of an individual also decides whether how susceptible an individual is to to all these diseases and the environmental changes. But genetic factors cannot be changed. So the only thing we can change is the environment. So we should make an effort to keep our environment more friendly so that we don't age faster. Then better healthcare services has obviously been the best way to prevent the diseases in a secondary way, and by keeping the diseases under control. Like for example, if someone has diabetes, by giving them anti-diabetic medications and all these healthcare services, we can prevent the complications of diabetes and cause secondary and tertiary prevention of diseases. Now, next we'll come to mental health. As you all, apart from physical illnesses, mental illnesses also affect the geriatric population. Their memories get weak and they get diseases like Alzheimer's, Parkinson's, and it destroys their ability to function normally. Our mental health can be preserved, like somewhat, it can't be preserved completely, but it can be preserved by doing activities that keep our brains active, like reading books and playing mind games. Reading books and playing mind games has been shown to prevent and reduce dementia in old age people. Also, social status of an individual also plays an important role in mental health. Some individuals whose children leave them alone or they don't have children, they suffer from isolation and depression, which can also cause mental illnesses. They don't have a family, they don't have a job to keep them occupied, and their friends and all are dying. So this contributes to poor mental health in this community. So mental health is very important in the geriatric population. Only if you have a healthy mind, we can have a healthy body. So more than healthcare, I think they need therapy. They need someone to hear their problems out and someone to talk to. So I think counseling and therapy can increase the health in this geriatric population. Also, they can join some support groups and old age homes that may where there'll be people around them who are also facing the same problems, so they feel like they're not alone. In India, there are many programs for old age people, like National Policy on National Policy for Older Persons, which creates old age homes and provides financial security to these individuals, and also provides mobile healthcare units and takes care of their welfare in old age homes. Another program is Old Age Social and Income Security Program, or OASIS. It offers concessions in Indian railways and airways for senior citizens. And Indira Gandhi National Old Age Pension Scheme also gives 200 rupees per month to the geriatric population. HelpAge India is the biggest voluntary organization which has provided many old age homes, free cataract operations, mobile medical units for old age people. And the one policy which I like the most was Adopt a Grand policy. This has helped many elderly people to get families. Like families can adopt some old age person as their grandparent, so that the children who don't have an experience of grandparents also can get an experience, and also the old people who don't have a family can get a family. So that's all I have to say about my poster. Thank you for listening.
Dr. Chitra ma'am, would you please like to give your inputs regarding her poster?
Yes. So Sasha, very good. I'm very happy with the poster presentation that you have given here. Very attractive, very simple, and catchy slogans also. Like this is one poster that I like because not very cramped or crowded messages. No huge texts are put in here, so it's very attractive. So congratulations for that, for understanding what a poster is, first of all. And you had also listed out some initiatives by the government, and you have also given here in this poster on how to age healthy. So what are the factors and what to do and all that. Now with all this in the background, can you give us some suggestions to the government, to the policy makers to make or support healthy aging possible?
Okay. I think most programs focus on physical health, but they don't focus as much on mental health. So I think most of these old people, like I'm telling from my experience, my grandparents and all become happy when I listen to them. They just like to complain about their problems. They like to talk about their problems. So I think the government should make free therapy services for these people. They just need someone to talk to, someone to listen to them. So I think it will be good to start some mental health measures for pediatric population.
Something else apart from targeting only the aged population, do you all also want to target someone else in the community?
Generation also has to be targeted. So we also need to give our grandparents and our relatives time, and we also need to educate them about since they weren't that educated, we are more educated than they are. So we have a responsibility to create awareness about this to them. We can talk about this to them, and we can be more considerate about them.
Good. Thank you, Ma.
Thank you, ma'am.
It was really good, yeah. Just one thing. How else do you think you can help in maintaining the mental health of our senior citizens? Apart from what you have suggested, any specific program or policy you have in mind for enhancing the mental health of the people, elderly population?
I think we can do early screening for mental disorders also, like Parkinson's and all. Many people have it but don't realize it. So whenever they come for some physical problems, like they have a knee pain or they have some pains, we can do a general screening for mental disorders also, so that if we can prevent it early, it won't become more worse and affect them much in future.
Yes, yes, ma'am. Thank you. Good.
Thank you.
After that interesting discussion, we have our next participant, Praveen J, a second-year MBBS student from Govt. Tiruvannamala Medical College, will be presenting next. We will present the posters from our side. Kindly do keep your audio and video on.
Am I audible, ma'am?
Yes, ma'am.
Okay. Good evening to all. My name is Praveen. I am from Govt. Tiruvannamala Medical College. Thank you for participating in this opportunity. My topic is digital health. What is digital health? We know health. Health is defined as the physical, mental, and socially well-being. Likewise, in digital, along with the development of computers, health is also gradually increasing. Now, in this poster, first we see introduction. Can you zoom to the introduction, please? Health organizations all over the world are developing and implementing digital health strategies. Like all organizations are first we seeing the more developed countries based on health only. Like US are saying USA or developed countries, and we are developing countries. On what criteria we can say that? We can say this criteria based on only health only, the health and technology. So previously it was described as the health IT or e-health. Now it is replaced. Now it is replaced as the healthcare or digital health. Next, define digital health. What is digital health? Digital health is defined as the health and healthcare in the context of digital societies. Now we see the evaluation of digital health. There are 4 waves of digital health. First, computer was invented in early 1940s or around 1950s. Along with this, health education or health digital system also evolved. In first wave, we initially has been recorded to the what are the problems we faced during the First World War or after the First World War, 1920 to 1930. In those years, we faced many problems. Those problem-oriented medical records are filed in the first wave. That is called the first era of digital health. named as ICT in health. On those in the first wave, we don't have any hardware or software, so we we only functionally driven and man-made health only we can see. Next, in second wave of mid 1960s, health ICT. First, what is ICT? ICT is nothing but the information communication technology. The second wave is mostly focused on healthcare organization. In the second wave, we developed some software and hardware to store these details. In the mid 1960s, many in the digital health or the computers, many tubes, vacuum tubes are replaced with transistors and punch cards. And the introduction of the higher level programming languages like Fortran and CABOL, these languages are introduced to make our work much easier to store the information or patient details. Next, US implemented patient care application during those second wave. Next, third wave. Third wave is named as e-health, e-health or electronic health. These electronic health principles are mainly derived from the demand and supply side. From demand side, it leads to the leading cause of morbidity and mortality. So those people request the greater sharing of health information. Like one part of the country getting more sick and more sickness and more death, more morbidity and mortality. They have overcome those morbidity and mortality. If another part of country will or another country in the world will facing the same problems, if they share us some knowledge on the how they overcome the diseases, how they overcome the that awareness like that if they share means we can give good health in the initial itself, we can prevent the disease. Second, patient also expecting us the healthcare workers to monitor the 24/7. Begin to expect their health needs to be satisfiable. Next, this is from the demand side. Then supply side. From supply side, along with mobile technologies and social medias, and the interaction technologies also will be mature. Next, the use of medical devices and the ICT will begin to give the medical devices. Next, fourth wave. Fourth wave now presently we use in the fourth wave. Up to from 2020 to 2025, these modification of this healthcare will be called as digital health and transforming care. This fourth wave having the deep knowledge of some aspects of the customers and the consumers. Range. This fourth wave is mainly discoverable from the evolved from the micro technology and nanotechnology. Now it is developed into the neuroscience. Now from the stethoscope to ECG. Initially we don't have any intercom at all. Only hearing the heartbeat and seeing the pulse itself, saying whether the patient is normal or abnormal. Now we can use it anywhere in the step. You can place the step and ask for it and see the patient. Likewise, in future, the step also can be replaced by some other devices. This digital health has a many role in the evidence-based medicine. Previously, we give treatment only on clinical-based knowledge. Now it is fully, according to the recent CVM, right? It is fully evidence-based medicine. So digital health also plays an important role in this. And another national, according to WHO, World Health Organization has a motto that this digital health, the purpose of digital health to promote the healthy lives and the well-being for everyone and everywhere at all ages. Then what are the health analytics we can give to the patient? We can give much care to the patient. And the quality of data. The data which will be storing of the patient information should be well maintained by security system, well-maintained security system. And wellness means patient for screening and early detection and screening, public health, disease surveillance, fraud detection. Fraud detection means whatever be the development of technology, along with that, there is also some disadvantage. One of that is fraud detection and fraud classification. Next, policy formulation support. Next, what are the main principles of NDHM? NDHM is nothing but the National Digital Health Mission. There are some. There are two main principles. One is domain principle, and another one is the technology principle. Domain principle. What are the domain we should teach the patient? Educate the empower to use those technologies, and universal, inclusive, security and inclusive, national portability. And technology principles. Technology principles are interoperable, single source of truth, and minimalist design. Now, what are the characterizations of the digital health era? Digital citizen and consumer centricity, and new entity, industry convergence, role convergence, and origin of the data, analytics, and algorithms rather than health. First, we thought that the USA will be bringing the digital healthcare system. Now, according to the recent survey, says that Australia has a better healthcare system and better developing than the US. They will be modifying some modulations and the criteria, strategies, following strategies like that and all. What are the other advantages of this digital health system? If you store the patient information report in some documents or files, in case of any calamities like flood, earthquake, these medical records can be damaged, and we lost the patient's data. If we digitalize those information on some devices, PCs, we can get those information, and according to those reports, we treat the patient. Okay, that's all. Thank you.
Dr. Chitra ma'am, would you like to give your inputs regarding the digital health poster that was presented? Dr. Chitra ma'am, am I audible?
Yes, sorry. Audible now?
Yes,
yeah. Praveen?
Yes, ma'am.
Yeah, you had beautifully depicted the evolution of digital health.
Yes, ma'am.
So, in terms of digital health, where is India placed when compared to the rest of the world?
India is a developing country, so we have to improve much.
Okay, you said Australia is performing better than the US and all that. So,
according to the on that list, India is in a bottom only, ma'am. Not that much improvement we can see.
Okay. You know, our people are all over the world employed as IT professionals. Go anywhere, any country, we find our Indians working. But
Yes.
then why we are not ahead in digital health?
Educating empowerment, only education of the, because only up to certain people only able to operate this digital PCs, laptops, mobile phones, up to only 40 or 45 ages now. Above that 50, 55 age people cannot able to use, or they don't know how to use these gadgets. We must educate them to use how to
Okay,
use.
so we need to technologically educate them. One, any other factors? Is the onus only on the people who are not technologically sound? Or are there any other factors which don't favor the digital health in India?
I don't know. So I'm not sure.
Okay, okay, pa. Thank you.
Thank you, ma'am.
Dr. Kanchanamala ma'am.
Yeah, Praveen.
Yes, ma'am.
in your poster, under the heading of health analytics, you have mentioned about fraud detection, and in that you have said that fraud classification. What do you imply by that? What do you imply with this fraud detection and fraud classification with relation to health analytics?
Ma'am, if we have a problem between two countries like India and Pakistan, they give us a cyber crime. So they involve in the healthcare system and detect our files. That is that will that is the fraud detection and classification and publishing the patient details.
Okay, so how is it is like
Yes, ma'am.
any
This
other
is-
significant? Yeah,
This,
tell me.
this is the disadvantage. This is one of the disadvantage in the digital health. Now, we must build a more firewall to protect these health system files.
Okay. And another doubt I have, in principles of NDHM, you have described about the domain principles and technology principles. Could you just elaborate on them?
Yes, ma'am. Domain principle is domain principle is educate, empower, ma'am. That is really saying that giving the knowledge to educate the people who don't know to use these gadgets. The universal inclusive means sharing the knowledge and patient information reports wherever and whenever needed. And third part is security and inclusive. Security means we give more protection to this system. National portability means, however, we protect these files also. Even though we protect these files, the national healthcare workers should know what are the which patient having which disease, like that.
National portability.
Yes, ma'am.
Yeah. What do you mean by that?
If like for example, if some patient is diagnosed to have AIDS, means we didn't usually include disclosure directly to the patient, or we must give first counseling to them. Even though we give counseling, the patient did not able to accept it, so that he will not spread to other people. We must inform to the family and protect the others and society, no ma'am, like that.
Okay, ma'am. Anything else you want to add? Anything else you want to add, Praveen?
No, ma'am, no, that's all, ma'am.
Okay, thank you. Thank you.
Thank you, ma'am.
We'd like to take this opportunity to personally thank Dr. Chitra ma'am and Dr. Kanchanamala ma'am for presiding over the digital poster session. If the participants on the call are requested to kindly wait for one of the participants, Padalishwara Ratnam. Our team is trying to contact him for the same. So I'd kindly request you to wait for 2 minutes, all the participants on the call and the judges as well. Good afternoon to all the participants and judges on the call. Our team tried to contact Padaleswara Ratnam from Government Tirunelveli Medical College. Unfortunately, he couldn't be reached through phone or text. We deeply regret this inconvenience, and we'd like to thank our judges again for taking their time off in judging this competition. Now, over to Dr. Kamali ma'am, Assistant Professor of the Department of Community Medicine, Government Medical College, OMANDURAR Government Estate, to deliver the vote of thanks.
Yes, ma'am.
Good afternoon to everyone present. I would like to take this opportunity to thank all the participants for having shown interest in this program, Ignozia 2022, and having presented in the various sessions. I would also like to thank our judges, Professor Dr.Chitra ma'am and Kanchanamala ma'am, for having consented to judge the session and give their valuable inputs to the students. I would like to thank the CRMI batch of 2022, A batch, who have actively involved in from the first step to the last stage of this event, and having completed this program, and for all their work they have done, I thank them. And I would like to thank our faculty members for having supported the event and lent their valuable guidance. I would like to thank our professor, Dr. ARUN Murugan sir, for his guidance and motivation. Thank you for thank you all. Thank you all.
To all the contestants on the call, we'd like to thank you for your patience. Our team is in contact with the judges and are tabulating the results as we speak. So kindly be on the call for the next 10 minutes. The results will be out in the next 10 minutes. Thank you. Ready. Good afternoon again to all the participants on call. Our judges and our team are calibrating the results as we speak. So in the meanwhile, we'd like to ask the contestants for their feedback about the event that has happened now. Is there anyone that'd like to unmute and talk about their experiences in this Ignozia event? Your feedback will be valuable to us in conducting future events.
This is the first online event that I've attended, and I think it was conducted really well. I liked it.
Are we talking to Shazia now?
Yeah.
Thank you, Shazia. Is there anything else that you'd like to add?
No, I don't think so. It was good.
Thank you, Shazia. Is there anyone on call that would like to share their feedback as our team is calibrating the results? Feedback doesn't have to necessarily be positive. So if there's anything that you'd like to tell us about how we can improve the event, it'll be really helpful. Thank you. Thanks again. We'd now like to move on to the results.
Good afternoon, one and all. I'm Dr. Rajesh, Assistant Professor from the Department of Community Medicine, OMANDURAR Medical College. At this outset, I would like to appreciate all the participants for participating actively in all the 3 events. So it was a very nice competition. And I would also like to thank the judges for judging the events. And so now coming to the results. So I would like to first announce the results of the research poster presentation. So the first prize goes to Govind Gopakumar, 3rd MBBS student from ESI Medical College, Bangalore. Second prize for the research poster presentation goes to Akash G, CRMA in Dhanalakshmi Srinivasan Medical College. And the consolation prizes goes to Apurva Reddy, 4th year MBBS of Medicity Institute of Medical Sciences, and Karthik M, CRMI from Tagore Medical College and Hospital, and Vishwajit GV, 2nd MBBS student from Government Coimbatore Medical College Hospital. Congratulations to all of you. Now coming to the results of the scientific poster presentation, the first prize goes to Shazia Muzzin, 3rd year MBBS student of Government Tirunelveli Medical College. And the second prize goes to the Ilayamadi I, CRMI of Karpaga Vinayaka Institute of Medical Sciences. And the consolation prizes goes to M. Ridula, 3rd year MBBS student of Mahada Medical College, and Praveen J, 2nd year MBBS student of Government Tirunelveli Medical College. Coming to the congratulations to all, and coming to the essay writing competition, the first prize goes to Sandhya K, 3rd MBBS student of Mahada Medical College. Second prize goes to Swatika S, 3rd MBBS student of Karpaga Vinayaka Institute of Medical Sciences. And the consolation prizes goes to Arun, 2nd MBBS student of ESI KK Nagar, Pooja Sri Ramula, CRMA of Government Medical College, Mahabub Nagar, and Shivani S, 2nd MBBS student of Government Kilpak Medical College. Congratulations to all of you. And so with this, I would like to appreciate all the participants and prize winners. So kindly continue the academic quest and then thirst for knowledge. in the community medicine and the other departments in the forthcoming years. Try to participate in more and more academic events. So with this, I would like to thank all the participants, and yes, we come to the end of today's session. Thank you. Thank you all for joining.
Hearty congratulations to all the winners. All the winners will receive their prizes via post in 10 to 4 working days. All the winners will receive their prizes via post in 10 to 14 days.